Hi everyone. Hope you are all doing good. Good evening, everyone. Am I audible? Hello.
Yes, ma'am. Audible.
Audible. Okay. എൻ്റെ പിള്ളേരൊന്നും അനങ്ങുന്നില്ലല്ലോ. Where is നവജീവൻ? കാണുന്നില്ല ഇന്ന്. Okay. Hi Pookie. What a cute name. Okay. So we can start. So first I'm going to take amino acids which is left over. So that is we have to start with sulfur containing amino acid because it's a very important topic where good evening Navjeevan. Yeah, so sulfur containing amino acid. So I will introduce to you who are the sulfur containing amino acid. So the first one is which are the sulfur containing amino acids? Chade, put it in the chat box. I will draw the structure. Yes, methionine and cysteine. Okay, right. So methionine and cysteine is what we are going to draw now. So the methionine is cysteine means there's a carbon atom on either side. What you can see is this is what happens? Ay, yeah. So carbon atom on one side you can find NH2. On the other side we can find COOH, and down what we can find is there is a CH2, and terminal you can find an SH group. No need to learn the structure, okay? I just want you to introduce to you who is this. This is cysteine. So in cysteine what you can see is there is a terminal SH group. This is very very important because whenever there is coenzyme A, coenzyme A, acyl carrier protein, all these things whenever you write, you can see that when coenzyme A you write it as COASH. So in all these something is happening with the writing part. I don't know why. Okay, so whenever you write that SH and glutathione, if we are writing, we write it as GSH. So that SH, every SH group is mostly in the proteins are mostly contributed by the cysteine. Okay, so cysteine is having a terminal SH group. Then what about methionine? The methionine is having, sorry. Methionine at the same time, it is having an NH2 here, COOH here, H here, then CH2, CH, S, CH3. This is the structure of methionine. Okay, so when I'm just going to show something to you that when we learn about methionine, just remember this. See, methionine up to that S. Okay, the methionine up to that S is homocysteine. Homocysteine. So you can see an extra methyl group here. So homocysteine plus methyl group is what is called as methionine. Okay, this is just to understand. So we will be learning about the metabolism of sulfur containing amino acids. So this concept should be clear. So methionine means it is a combination of homocysteine and methyl group. Okay, the second thing that we should learn here is there is a special group in the case of methionine, and that is called as the thioether linkage. Thioether linkage. Likewise, the SH group in the case of cysteine is called as thioalcohol, which means whenever there is a sulfur, there is one name that you can see in all these. What is that name? You tell me. Put it in the chat box. Whenever there is S, yes, thio. So whenever you see thio means what? It is that S. Okay. So with this understanding, we are going to learn the metabolism of methionine and cysteine, and from there we learn homocystinuria and few more other disorders. That is why we are going to learn this. Okay. So first, when I am saying methionine, so I am writing here methionine. Now, whenever I am writing methionine, what is methionine? It is actually a couple. It is a couple, and the partners in the couple are whom? You have to tell me. Vegam. What? Yes, homocysteine and methyl. So it is a couple, and the partners are homocysteine and methyl. Okay. So they are linked by this sulfur. Okay. So you can see that whenever they are joining, it is linked by that sulfur. So the first reaction that happens to methionine is this is a couple of homocysteine and methyl group. Somebody is very jealous about their relationship. So they want to break. There is a person who want to break that relationship. So for that, there is a villain here. So the villain here is adenosine. So methionine is combining with adenosine, and that enzyme is methionine adenosyl transferase. Methionine adenosyl transferase. The short form is MAT. Okay. So when this adenosyl group is attached correctly to this S, this S to this S, adenosine is being attached. So when the adenosine is attached to that S, then what is the product? It is S adenosyl methionine. Okay, so what is S-adenosyl methionine? What is the sweet short name of S-adenosyl methionine? Or what is that? Sweet short, yes, SAM. Okay, now this is how SAM is formed. So SAM is not two. SAM is having three. So the three components are the methionine is homocysteine is there, methyl group is there, and the villain is there, which is correctly targeted to the S, which joins the methionine with the methyl group. Okay, because adenosine has only one aim, to break their relationship. So now methyl group is feeling somewhat jealous, or what you say, it's not so happy with homocysteine. Methyl group feels that this homocysteine is giving some attention more towards adenosine, not to me. So why should I be with him or her? I'm not saying anything about gender. Let it be him or her. So why should I be with this homocysteine? I'm going away. This is the thought process of methyl group. So what happens? The methyl group is saying bye bye to S-adenosyl methionine, and there are lots of reactions where this methyl group is required. We have seen one example, norepinephrine to epinephrine. Then serotonin to melatonin. In all these reactions, many methylation reactions are there. Almost every reaction, this is the reaction that is happening. That is S-adenosyl methionine is converted to what? Now you tell me. When when the methyl group is going away from S-adenosyl methionine, what is the product? Yes, come on fast. Yes, S-adenosyl homocysteine, right. S-adenosyl homocysteine, right. Now, the S-adenosyl homocysteine has only one fate. Or S-adenosyl homocysteine, 1 minute. S-adenosyl homocysteine is now formed. Now adenosine is going to say bye-bye to homocysteine. So because adenosine had only one aim, that was to break the relationship. It is already done by adenosine. So adenosine is moving away. So in the next reaction, what you can find is the adenosine is moving away. So what is formed? Yes, tell me fast. Adenosine is moving away. So what is the product? Yes, yes. Ah, okay. So what we get is homocysteine. Okay. Now onwards, you should be knowing. ഇവിടെ വരെയൊക്കെ ഉള്ളത് if you forget also, it is fine. Now we are going to learn about the metabolism of homocysteine. This homocysteine, it is not having any partner. So this is very dangerous to our body. So these partnerless people, it is very dangerous. So chronic bachelors and spinsters are always dangerous. That is why free radicals are dangerous, because it has a lone pair of electrons. Okay. So this homocysteine is not so good for our body. So homocysteine has two thoughts. The first thought is, why should I reform methionine? I want that methyl group. Somehow I want that methyl group. That is the thought of homocysteine. So what will happen? The homocysteine is searching for methyl group everywhere, but it is not finding anywhere because nobody is going to trust this homocysteine. But there was one generous donor for this homocysteine, and that is N5 methyl THFA. N5 methyl THFA is a generous donor. It is ready to donate that methyl group. So this N5 methyl THFA donates that methyl group, and what is formed? THFA is formed. Okay. Now, when that is formed again, there is there are certain agreement, that is, or N5 methyl THFA has some sort of agreement with the homocysteine. That is, I am not going to give this methyl group directly to you because I'm not going to trust you. I need a mediator here. So who is the mediator here? The mediator here is B12. B12 is a mediator. So the B12 receives that methyl group so that it becomes methyl B12. Okay. Now this methyl B12 gives that methyl group so that methionine is reformed. So this is the first fate of homocysteine. That is, it is reforming the methionine. Okay. That is one fate. The second fate of homocysteine is, it is thinking, I don't want that methyl group again. So whoever has gone from me, let it go. I don't want homocysteine again. That is the thought of homocysteine. So it is going to find somebody else. So the homocysteine is going to find serine. Okay, another partner. So homocysteine and serine is joining to form a couple, and this is called cystathionine. It is called cystathionine. And that enzyme, can anybody tell me the name of this enzyme? One minute. I need a break for 1 minute. I'll just take a Okay, sorry for that. Somebody was at the door. I need to open. Okay, fine. Okay, so what we have seen is the homocysteine is combined. Yes, that enzyme is combining with serine, and that enzyme is cystathionin beta synthase. Okay, now who will tell me what is the vitamin required for this? What is the vitamin required for cystathionin beta synthase? Very good. PLP. Okay, so that require PLP, otherwise vitamin B6. Okay, now this cystathionin is already ഒരു relationship broken, again combining with somebody else. So there is always a chance for further breakage. So now this is going to break once more, but this time the fate of homocysteine was even more fatal. The reason is serine joined with homocysteine. Now the serine has taken some alimony also, or it is claimed for alimony also from homocysteine. Okay, so what is formed here is serine becomes homoserine, smart, right? Serine becomes homoserine. Homocysteine became, tell me, poor homocysteine, right? It became cysteine. Okay, that enzyme is cystathionase. Cystathionase. This enzyme also require the same vitamin. So which is that vitamin? Tell me. Yes, again, this is also requiring PLP. Okay, now I didn't tell you the name of the enzyme which convert homocysteine to methionine, and that enzyme is methionine methionine synthase or homocysteine methionine synthase or homocysteine methyl transferase. Explainable, right? The name is transferring a methyl group to homocysteine. So that is the name of that enzyme. Okay. So in this reaction, I am going to mark some metabolic disorders. It is not the reactions that you have to learn. You have to learn the metabolic disorders here. So first reaction or the first metabolic disorder I'm going to mark here is a block here. So if there is a block in the enzyme called as MAT, it causes primary hypermethionemia. Primary hypermethionemia is the enzyme here. The disorder here. And this primary methionemia has a characteristic order. And can you tell me what is, whenever methionine is accumulating, there is an order, body order. What is that? If anybody knows it, yes. Whenever methionine is accumulating, not garlicky, yeah, cabbage, yeah. വെളുത്തുള്ളി അല്ല cabbage ആണ്. Okay, so it is boiled boiled cabbage smell. That is the order. Okay, right, that is enough. Next, what you have to see is this defect, cystathionin beta synthase. Cystathionin beta synthase defect causes what? Tell me. You can tell me. You know that. Yes, fast. Cystathionin beta synthase defect. CBS. Defect causes what? Yes, yes, that spelling is very important. It is homocystinuria. And this is either we can write homocystinuria type 1 or we can write it as the classic homocystinuria. Okay. Classic homocystinuria. Then if there is a block here, it causes cystathionuria. Cystathionuria. Okay. Now, if we go up, if the upward fate is defective, then it is type 2 homocystinuria. Type 2 homocystinuria, or we can also write it as non-classic homocystinuria. Non-classic homocystinuria. So these are the disorders here. We will be seeing about this classic and non-classic. In this, I have told you about many disorders here, but finally what you have to learn is only classic homocystinuria and about non-classic homocystinuria. So these are the two things that we are going to learn now in homocysteine and methionine metabolism. Okay, so first we are going to see the homocystinuria. Homocystinuria. Now my question is, what is this homocysteine? What is the difference between cysteine and cysteine? So let us see that. This is not for you to learn, but to understand. What is the difference between cysteine and cysteine? Okay, fast ആയിട്ട് ആൻസർ വരുന്നില്ല ഞാൻ പറഞ്ഞുതരാം. Okay, cysteine means we know that in cysteine there is a SH group, right? Again, one more cysteine, there is an SH group. So these two join in such a way that these S and S is forming a disulfide bond. So usually, whenever the cysteine level accumulates in our body, usually it is not seen as single like cysteine. It's always seen joined together. It is always seen joined together as a pair. Then it is called as cysteine. Likewise, homocysteine and homocysteine, what is the difference? Now, can anybody tell me? So I've explained about cysteine and cysteine. You tell me about the difference between homocysteine and homocysteine. Okay, oxidized product. More than that, just similar to what I have told you just now. Cysteine means two cysteine joined together is cysteine. Likewise, ah, homocysteine means, so we know the structure of homocysteine. So if one homocysteine, TEINE, okay, it has one SH group at the end, is joining with one more homo TINE at the end. SH is there at the end. So H and H get cancelled, they form a bond. Now this is called as homocysteine. This is called homocysteine. Okay, so just understand. Nobody is going to ask this. Just understand the difference between homocysteine and homocysteine, cysteine and cysteine. Okay, that is it. Okay, now, once you have understood this, we are going to see the homocystinuria. So, in homocystinuria, what we have seen is there are two types of homocystinuria. So, this is homocysteine, two fates of homocysteine. One fate is to get converted to methionine. So, which are the two vitamins required there? One is N5 methyl THFA. I'm not writing the reaction. And this also require methyl B12. So, two vitamins are required there. One is B9 and the other is B12. So, if there is any defect in B9 or B12, then the upward fate is affected. If there is any defect in the downward direction. That is, it is combining with serine and it becomes cystathionine, and I'm not writing about cystathionine. I'm just writing cysteine plus homoserine. One more step is there. I'm not writing. That's all. Okay. So if there is one here, we know that we will discuss about this defect first. Then we'll discuss about the second defect. So if there is a defect here, what we can see is there is increased homocysteine in blood. Now, whenever there is increased homocysteine in blood, usually what happens is they combine, and what is excreted? It is not excreted as a single amino acid. It is usually excreted as a doublet. That means it is usually excreted as homocysteine. So, this is why this condition is called as classic homocystinuria. Classic homocystinuria. And what is the enzyme that is defective there? You can write it here as or here. What is the enzyme defect? We'll write the short form CBS. Cystathionine beta synthase is the defect there. So, if it is a classic homocystinuria, tell me two things now. What will happen to the level of methionine and what will happen to the level of cysteine? So if there is, so I'll show it once more. You can see if there is a defect here. My question is, what will happen to methionine level and what will happen to cysteine level? Yes, correct, correct. Okay, cysteine level decrease. Methionine level, we cannot say increase, but because methionine evidna form in the methionine, like whatever homocysteine is formed, it is from methionine, right? So we cannot say methionine increase. We can just say methionine level is normal. Okay, don't say it is increased, but say it is normal. So methionine level is normal, but the cysteine level is reduced. Okay, so this is what happens in classic homocystinuria. Now, what will happen? Homocysteine accumulation is always harmful to our body. So, what are the clinical features of homocystinuria? Because if a case is given to you, how are you going to identify it? So, we'll see one by one. It has multiple skeletal deformities. It has multiple skeletal deformities. Okay, just see this picture and tell me which are the deformities. What about this one? I'm not able to write it on that, but still, tell me which are the deformities that you're seeing here. Yes, I'm not saying anything. You have to tell me. Seeing this picture, you have to find out. Scoliosis, correct? Yes, subluxation of lens. Yes, you can see sternum pushed in. That is pectus excavatum. Sometimes the sternum can be pushed out. That is called pectus carinatum. Okay, ectopia lentis. Yes. Then in the hands, what you're seeing? Looks like the legs of a spider. That is a key word here. Looks like the legs of a spider. Arachno. Yes, it belongs to arachno. Species ആണോ family ആണോന്ന് എനിക്ക് ഓർമ്മയില്ല. So, spider, yeah. Arachno, it's always something real. Arachnidae is a spider ന്റെ ഒരു എന്തോ family species എന്തോ ആണ്. Okay, arachnidae is spider. Okay, so the arachnodactyly means it looks like the long, slender fingers, like long, slender legs of a spider and the long, slender fingers. So that is called arachnodactyly. Okay. Then these children are mentally retarded and they have a characteristic gait which looks like a comedian. So what is that gait called as? What is that gait called as? Yes, Charlie Chaplin gait. Okay, correct. Charlie Chaplin gait. Okay, now you write the clinical features. I'm not going to write it for you. You have seen, by seeing this picture, please write the clinical features. Plus, you write about mental retardation. All of you write. So I'll give you 2 minutes. No, 1 minute. Please write the clinical features. Most of the clinical features are there in the chat box, or else you can see the picture and write. എഴുതി കഴിയുമ്പോൾ you please see, give me a message done. ടെസ്റ്റ് ട്യൂബ് പറഞ്ഞുതരാം. Done. Yes. All of you done? Okay, okay, okay. Right, 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 right. Good, 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 good. Oof. So love you so much. Okay. Okay, okay, right. So what is the test tube? That is the question, right? That is a test which is called cyanide nitroprusside test. It is called cyanide nitroprusside test. ആർക്കെങ്കിലും chat box ഇടാവോ? Can you put that in chat box? Cyanide so that everybody can see. Cyanide annotate ചെയ്യല്ലേ please. Cyanide nitroprusside test. ഗുണ്ടാണോ? Yes, correct, correct. Cyanide nitroprusside test. It is having, what is the color that you can see? It is a magenta color. It is a magenta color. Okay. So that is about okay, so that is ആർക്കാണ് എന്തെങ്കിലും പ്രശ്നം ഉണ്ടോ? Okay. So skeletal deformities, mental retardation, then all the yes, genu valgum, if you want to add, you can write that genu valgum or varum. That means the knee deformities are there. So apart from that, knee deformities, then pes cavus or pes planus, plus homocysteine is a very, or it's a risk factor for thromboembolism or thrombosis. It is a risk factor for thromboembolism. Thromboembolism. Okay. So how will these patients present to you? Sometimes with visual disturbances, iridodonosis, or visual disturbance can be one presenting feature, or they present with chest pain because they are prone to develop coronary artery disease. They are prone to develop coronary artery disease. Now, if you see all these picture, is it similar to something else? Yes, tell me. It's similar to. Yes, Marfan's. So, homocystinuria resemble Marfan's syndrome. But in Marfan's syndrome, few differences are there. One is the dislocation of the lens is superotemporal. Superotemporal, plus there is no mental retardation in the case of Marfan's. No mental retardation. Okay, so these are the two differentiating features. You can remember it like that. Fan evideya kana? Where can find the fan? On the roof, right? So like that, Marfan's, the dislocation is supratemporal. Then what about the dislocation in the case of, you have written about ectopia lentis, right? Ectopia lentis in homocystinuria. And what is the location? Dislocation direction? Yes, infromedial. Yeah, nasal. That is also right. Infronasal or infromedial. You remember it like this. When we pass urine, it is passed down. So it is a downward dislocation. So it is infromedial. Okay. Whereas fan top, so it is so superotemporal. Remember it like that. Now, what is the treatment here? So I have told you about the test that we do here, plus all the mutation studies, enzyme studies. Repeat every metabolic disorder, whichever investigations are there, you can do it here also. Enzyme studies, mutation studies, chromatography, all these things you can do. Plus, what is the treatment? The treatment here is high dose of high dose of B6. Okay, that is one thing. Then we have to supplement something. Tell me what we have to supplement. It's a very, very important question. Supplement which vitamin? Sorry, which amino acid? Okay, PLP, that is high dose of B6. Yes. Supplement cysteine. Supplement cysteine. Then we can also give other vitamins like B12 and B9. We can give, but most important thing is we give a high dose of B6. Plus, there is a important treatment that is betaine. Betaine എന്താണെന്നറിയാമോ? Yes, B9 കൊടുക്കാം, B12 കൊടുക്കാം. Now, what is betaine? Betaine, trimethyl glycine. Even if you forget what is betaine, that is fine. But understand why we are giving betaine. It is because betaine has 3-methyl group. What we ultimately want is we want to reduce the accumulation of homocysteine. So the betaine is going to convert homocysteine to methionine. Betaine is going to convert homocysteine to methionine. So nowadays in cardiology, anybody is here who worked in cardiology? How? Okay, high doses because we want to, even if some residual activity of that enzyme is there, we want to augment its activity. That is why we are giving high dose. Whenever we are supplementing a cofactor or a coenzyme for any enzyme defect, we are giving it in high dose. MSUD, we are giving high doses of thiamine, like that. So high dose is not something which is different in this case, in every case. Whenever we are supplementing, we are giving high dose. Okay, fine. So the question is homocysteine to methionine. So is there anybody who has worked in cardiology department here? Okay, I will share a story, not like a story, but one of the students in one class, she after the after this session on homocystinuria, uh, that he gave me a report. He gave me a report of a patient who presented with a myocardial infarction. So in cardiology department, it is like a routine test that we are giving to every patient with myocardial infarction. We'll check the homocysteine level. So whenever the homocysteine level, in most of the cases, I'll say that student was also telling me most of the cases of myocardial infarction, they are finding homocysteine level high. Okay, so homocysteine level high means it is a predisposing factor for thromboembolism and myocardial infarction. And many of the time, these cardiologists are prescribing betaine to the patient. because they want to reduce the amount of homocysteine. How they are going to reduce the amount of homocysteine? That is, it is going to remethylate the homocysteine back to methionine, because methionine is not harmful. Homocysteine is always harmful. Okay, so that is about classic homocysteinuria. I hope that is clear to you. Yes or no? Yes, okay, right. Okay, right. So that is about classic. Now we are going to see about the non-classic. Yes, very good, very good. Love you so much. So now we are going to see about the non-classic. Where is the defect in non-classic? The non-classic, I'm writing it again. Non-classic, the defect is the conversion of homocysteine to methionine. Here is the defect. So it can be either due to a defect in methyl B12, methyl B12 formation, or it can be a defect in this enzyme's name. Even if you don't remember, that is fine. ഞാൻ just പറയുന്നേ ഉള്ളൂ. Methylene THFR reductase. Short form എന്ന് പറഞ്ഞു കഴിഞ്ഞാൽ MTHFR. Methylene tetrahydrofolate reductase. The problem with methylene tetrahydrofolate reductase is it reduces the availability of N5 methyl THFA. Or it can be a methyl B12 formation defect. Or you just understand that if there is any deficiency of B12 or if there is any deficiency of B9, then homocysteine cannot be converted to methionine. Okay. So this is called as what? This is called non, ഈ എൻസൈമിന്റെ പേര് കമ്പൽസറി അല്ല കേട്ടോ. ജസ്റ്റ് അണ്ടർസ്റ്റാൻഡ് B9 or B12 defect. So that is called non-classic homocysteinuria. Non-classic homocysteinuria. So in non-classic homocysteinuria, what will happen to homocysteine level? Tell me. ശ്രദ്ധിച്ചിരിക്കണം, ഞാൻ ഇടയ്ക്കിടയ്ക്ക് ചോദ്യം ചോദിക്കാം, അപ്പോൾ ഒക്കെ ആൻസർ വേഗം വേഗം പറയണം. യെസ്, ഇൻക്രീസ്. Homocysteine increase. So naturally, what is excreted in urine is? Tell me. Homocysteine എപ്പോഴും, whenever it always joins and it becomes homocysteine. So what is excreted usually in urine? It is homocysteine in urine. Usually അങ്ങനെയാണ് excreta. Homocysteine in urine. Okay, fine. Now you tell me what will happen to methionine level. What will happen to methionine level and what will happen to cysteine level? പറയൂ, വേഗം പറയൂ. What will happen to methionine and what will happen to cysteine level? Yes, methionine level, methionine is not being formed, so methionine level is decreased. What about cysteine level? It is, we can write it as normal. Write it normal or slightly increased also, it is fine. നമുക്ക് കറക്റ്റ് ഇങ്ങനെ അങ്ങനെ കറക്റ്റ് പറയാൻ പറ്റുമൊന്നുമില്ല, ബട്ട് സ്റ്റിൽ യു ക്യാൻ ലേൺ cysteine level is normal, whereas or it can be increased also, because the downward direction there is no issues, upward direction is defective here. So methionine level is reduced here and cysteine level is normal here. This is how we differentiate between classic and non-classic. So in non-classic, what is the treatment that we are going to give? Features are almost same because homocysteine is ultimately accumulating here. So features are almost the same. Then what is the treatment here? Definitely we have to give B6, a combination of B6 and B9 and B12. Unlike in the other case, the first thing we are giving is high dose of B9 plus B6 and B12 also we can give. But primarily what we have to give is B6 there. Now here we are giving a combination of B12, B9. Along with that we can give B6 also. So it's a combination of B6 plus B12 plus B9. Then this is what I'm going to say is very, very important. Supplement dash. You have to tell me. Which amino acid? Yes, very good. So here we have to supplement methionine. Okay, so that is homocystinuria. Various, ഇത് വളരെ പ്രധാനപ്പെട്ട, it's very important. Various ways the question came for. Last NEET also homocystinuria was a question. I think that was a case of non-classic homocystinuria. So in that, the treatment is a combination of B6, B9 and B12. That was asked. Okay, in various ways, and also not only for your okay, not only for your exam, but also when you are practicing as a physician or a cardiologist or whatever is it, this homocysteine accumulation is very, very important now because we have to prevent it. Homocysteine accumulation should be prevented. So for that, betaine is given. So that time, that student shared that story because only after your class we understood why we have given. I have prescribed betaine many times, but I never understood why I'm giving betaine. So that is remethylation. Okay, so this concept should be clear in your mind. Okay, so we have learned about the classic and the non-classic homocystinuria. Now here also we can give betaine. Okay, betaine can be given in any cases of accumulation of homocysteine. Okay, so that is about homocystinuria. And then two more disorders and two vitamins I have to explain here. The two more disorder that I have to tell here is about, I should say something about cysteine here. Cysteine. So we have seen cysteine is formed, and from cysteine, what are the compounds derived? The compounds derived from cysteine are number one, cysteine. Very easy to understand. Number two, glutathione. Glutathione. Then the next thing is from cysteine we are getting taurine. Taurine. ഇനി ഒരു പേരും കൂടെ ഉണ്ട്, അത് ഭയങ്കര ഗുണ്ട, അതൊന്നും പഠിക്കണ്ട. സോ ബീറ്റ മെർക്കാപ്റ്റോ എത്തനോളമീൻ, അത് വേണ്ട, വിട്ടേര് അല്ലേ, വിട്ടേക്കാം അല്ലേ. ബീറ്റ മെർക്കാപ്റ്റോ എത്തനോളമീൻ വേണോ? വേണ്ട അതന്നെ വേണ്ട. We learned three. Cysteine is easy to understand. Taurine, you remember. Taurine is something which is going to conjugate bile acids. Sodium taurocolate പഠിച്ചിട്ടില്ലേ? So the taurate is taurine. Okay. Glutathione we have to learn. I will teach you glutathione later. Okay. So these are the compounds derived from cysteine. Karanam, nowadays this is a trending question. In the last INSET also a question was like match the following. An amino acid was given, the compound derived was given. Yes, very good. Oh, techna pova namo. Okay, so that is why I'm giving the compounds derived. Okay, so cysteine is ultimately derived from who? Tell me. Which amino acid? Cysteine is ultimately derived from methionine, right? Oof. Methionine. Okay, fine. Now we are going to see some disorders associated with the cysteine. Only two disorders. One is cystinuria. This is the most important thing that you should learn. Cystinuria. And one more is cystinosis. Just to understand the difference, that is enough. So, അതെങ്ങാനും ചോദിക്കോ ഇനി? ഇല്ലടാ, ചോദിക്കാൻ സാധ്യതയില്ല. ബീറ്റ മെർക്കാപ്റ്റ എത്തനുള്ള മീനൊക്കെ വിട്ടേര്. Okay, so two disorders we are going to learn is cystinuria and cystinosis. So first we are going to learn about cystinuria. So cystinuria and cystinosis, even though pair, if you see, if you hear, it almost sounds similar, but it is not so similar. It has two different entities. So what is cystinuria? Cystinuria is due to a defect in a dibasic amino acid transporter in the proximal convoluted tubules of the kidney. So there is the defect. So what happens? What is the role of this dibasic amino acid transporter? Its role is to reabsorb COLA. That's the role of it. So what is that C? What is that O? What is that L and A? Who will tell me? Come on, come on. ചോദിക്കൂല. Yes, വിട്ട് കളയാം. Yes, കളടാ. വിട്ടേരെ. We can just leave it. Okay, now come. What is the COLA? അയ്യോ ആൻസർ ഒന്നും വരുന്നില്ല. Okay, ornithine. Okay, right, Navajeevan, ornithine. Yes. Teresa is saying cysteine. Yes, cysteine. Okay, that is, remember, cystine. ഒരിക്കലും സിസ്റ്റീൻ ആയിട്ട് എക്സ്ക്രീറ്റ് ചെയ്യൂല. ഇറ്റ് ഈസ് ഓൾവേസ് ആസ് സിസ്റ്റൈൻ. റൈറ്റ് ഹിയർ നോട്ട് cystine, because that was a question asked in one of the exam. In cystinuria, which of the following is not excreted? O is ornithine. Then L is lysine. Okay, what is that A? Arginine. Correct. So arginine. So remember, it is not cystine, it is cystine. So this is called cystinuria. Now, when cystine is excreted in urine microscopy, if you do, you will get crystals of cystine. How it looks like? It is hexagonal in shape. Hexagonal crystals. This was a image-based question, okay? Image-based question. Hexagonal crystals in urine microscopy. So these are cystine crystals. Cystine crystals. It's flat-topped hexagonal crystal. So that is cystinuria. Now we go to what is cystinosis. Cystinosis is a lysosomal storage disorder where a cystine transporter in lysosomes defective. Cystine transporter in lysosomes defective. So what will happen? Inside the lysosomes, proteins are degraded. When proteins are degraded, amino acids are produced. So that includes cysteine, cystine and all. So cystine has to be excreted out, which is defective here. But cystine, okay, inside the lysosomes, it accumulate. This causes lysosomal degranulation or destruction. Now, this causes a lysosomal storage disorder. So, that is why this is a LSD, lysosomal storage disorder. And like in any other LSDs, it affects multiple organ system. It is going to affect the liver. In the liver, it causes failure. Then it's going to affect the kidneys, especially the proximal convoluted tubules. It affect, and it causes Fanconi's anemia. And renal failure. It is a part of Fanconi's. അത് നിങ്ങൾക്ക് വായിച്ചു നോക്കാം കേട്ടോ, about Fanconi's anemia. Then in the eyes, there is corneal opacity. In the lens, you can see crystals inside the lens which looks like sequins. Sequin-like crystals. Sequin-like crystals in the lens. So these are some of the characteristic features of cystinosis, which is a different thing. It is a lysosomal storage disorder. Okay. Now, I'm going to ask you. You have to tell me what is the, you have to type also, okay? Because just to know whether you understood it or not. I will tell you a disorder. You have to type the enzyme defect. Classic sequin പറഞ്ഞു കഴിഞ്ഞാൽ നമ്മളിങ്ങനെ എന്താ പറയുക, ഈ glitters ഇല്ലേ, glitters that we use. പിന്നെ നമ്മുടെ ഡ്രസ്സിലൊക്കെ ഇങ്ങനെ ഗോൾഡൻ ഡാൻസിനൊക്കെ പോകുന്നവർക്കറിയാം. സെക്വിൻസ് വെക്കൂലേ, ദാറ്റ് ഇസ് കോൾഡ് സെക്വിൻ. ഓൾസോ നമ്മൾ ചില ഗ്ലിറ്റേഴ്സ് ഇടൂലേ ഫോർ പെയിന്റിങ് ആൻഡ് ഓൾ, ഇങ്ങനെ ആർട്ടൊക്കെ ഉള്ളവർക്ക്. ഓക്കെ, ദാറ്റ് ഇസ് സെക്വിൻ. ഓക്കെ, ഫൈൻ. Now tell me, I'm going to tell you a disorder. You have to type the enzyme defect. Classic homocystinuria, fast. Very good. CBS, correct. Non-classic homocystinuria, enzyme venda. Okay. MTHFR, right. B9 or B12. Okay, right. Cystathionuria. MTHFR, right. Cystathionuria, first. Cystathionuria. അയ്യോ, മറന്നുപോയി അല്ലേ? ഓക്കെ, അത് അത്ര ഇമ്പോർട്ടൻ്റ് അല്ല, വിട്ടേര്. ആർക്കില്ലെങ്കിലും കുഴപ്പമില്ല. സിസ്റ്റാതയോണൈസ്. ഓക്കെ, ഗുഡ്. സിസ്റ്റൈന്യൂറിയ. വേർ ഇസ് ദ ഡിഫക്റ്റ്? സിസ്റ്റൈന്യൂറിയ. യെസ്, PCT, ഡൈബേസിക് അമിനോ ആസിഡ് ട്രാൻസ്പോർട്ടർ, കറക്റ്റ്. Then cystinosis. Cystinosis പറഞ്ഞാൽ it is a lysosomal storage disorder. Yes. The defect is in the transport of cystine. Yeah, transport of cystine, transporter of cystine transporter in where? Where iPad? Cystine transporter in lysosomes. Correct. Okay, so these are the disorders of now what we have to learn is about B9, B12, glutathione. ഇത്രയും കൂടെ ഉള്ളൂ പഠിക്കാൻ. So we'll just compare B9 versus B12. What is the source of B9 and what is the source of B12? What is the source of B9? B9 means folic acid. Folium means green leafy vegetables. Correct. Source is green leafy vegetables. Now, what about B12? Animal products. So who is prone to develop B9 deficiency? So in this case, deficiency in the case of B9, what is the history that we'll get? Pure vegans or pure non-vegans? Yes, correct. Pure dash, vegans or non-vegans? Yes, pure non-vegans. What about B12? Pure vegans. But if pure vegans who are what is the source of B12 in pure vegans? Source, if they are eating milk and milk products, curd is a source. ഇതൊരു question ആയിരുന്നു കേട്ടോ. Curd is a source. In a B12 deficiency, there are other reasons. Because if you see the metabolism of B12, we know that there is a requirement of a factor which is called intrinsic factor. Okay. So this intrinsic factor defect is required for absorption of B12. Intrinsic factor defect. Okay. So this intrinsic factor defect can happen in which all conditions? Tell me. Intrinsic factor is required for the absorption of B12 in the ileum. When it comes, it is secreted from a particular area. So, yes, gastrectomy. A question ആയിരുന്നു കേട്ടോ. Gastrectomy. So, ഇതൊക്കെ ഹിസ്റ്ററിയിൽ വരും. So, if the history is gastrectomy, then ഒരു anemia ഉണ്ടല്ലോ. What is that anemia called as? Intrinsic factor. It's an autoimmune disorder, a kind of autoimmune. Yes, pernicious anemia. Pernicious anemia. Then ഒരു infestation ഉണ്ട്, parasitic infestation. Hookworm. Yes, hookworm. Yes, latum, latum. What latum? സ്പെല്ലിങ് തെറ്റിയോന്ന് അറിയില്ല. എനിവേ ഡൈഫില്ലോ ബോത്രിയം. ഈ തെറ്റ് സ്പെല്ലിങ് തെറ്റുണ്ടെ കറക്റ്റ് ചെയ്യണേ. യാ latum. That is a fish type worm. Okay. So these are the yeah, correct. So നിങ്ങൾ ആരോ കറക്റ്റ് ആയിട്ട് എഴുതി വൈ ആണല്ലേ? ഓക്കെ, ഡൈഫില്ലോബോത്രിയം കറക്റ്റ്. ആ ശരി. So these are the common deficiency manifestation or the predisposing factors for deficiency. അപ്പോൾ so in the history of the എൻ്റെ അമ്മ അനോട്ടേഷൻ എങ്ങനെയാണെന്ന് വായിക്കും. So in the history, okay, correct. Okay. So in the history, if you get any of this, then this is how we can find out whether it is B9 or B12. Very, very important. Now, once we have find out whether it is B9 or B12, what are the enzymes that require B9? And what are the enzymes that require B12? B9, we cannot say. Almost every one carbon metabolism. Almost every one carbon metabolism. One carbon metabolism, it's very easy. Like just know methyl THFA, methylene THFA, every one carbon group, the vitamin which carries this one carbon group is always B9. So any one carbon metabolism defect or any enzymes in one carbon metabolism, they require B9. That is one thing. So what about B12? Only two enzymes. Okay, ഇപ്പൊ തന്നെ പഠിച്ചോണം, ഞാൻ ചോദിക്കും. So you have to learn it now itself. Only two enzymes. If you know, you can type. Only two enzymes. Already we have learned one. At least that you can type.
Methyl malonyl alcohol.
Yeah. Yes, yes, right. Can I write this? Methionine synthase or homocysteine methyl transferase. Okay, what is the next enzyme? Methyl malonyl coenzyme A mutase. Where did we learn this enzyme? Can anybody tell me? കാർണിറ്റിനല്ല മോനെ. Yes, gluconeogenesis, correct ആണ്. Entry of the 3 carbon yes, correct. Propionyl coenzyme, succinyl coenzyme പോകുന്ന വഴിയിലാണ് we require this methyl malonyl coenzyme mutase. Okay. So methionine synthase is like a one carbon metabolism. So methionine synthase require B9 plus B12, right? But methyl malonyl coenzyme require only B12. This is very, very important. Okay. So if there is so what are the findings or the investigations that we can do? B9 versus B9 versus B12. So in one carbon defect, what is excreted in urine? In the case of B9 is, this I will tell you later. You just write it here. Fig glue excretion. Fig glue, ഇത് നമ്മൾ പിന്നെ പഠിക്കും for fig glue excretion. Whereas if you go to the other side and plus, can I say homocysteine? Can I say homocysteine here in the case of B9? B9 and homocysteine, is it related? Yes. Good. So B9 deficiency, yes, correct. Homocysteine, fig glue are there. Now we go to the other side. On one side, we can see that there is homocysteine here as well. Is it right? B12, can we expect a excretion of homocysteine? Yes. Plus methyl malonic acid. Methyl malonic acid. This is only in B12. Very, very important. This is only in B12. Okay. Methyl malonic acid. But homocysteine is common. See, this is common. So if we want to find out a B12 deficiency, what we have to check is the methyl malonic acid. Okay. That is very, 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 very important. Plus, what are the clinical features? If there is a B9 deficiency, what we get is megaloblastic anemia. Megaloblastic anemia. Why? Why there is megaloblastic anemia? It's because there is decreased availability of tetrahydrofolic acid. Because if the B9 is defective, if there is decreased tetrahydrofolic acid, then what will happen? There is decreased one carbon transfer. One carbon transfer is, yes, DNA. One carbon transfer is required for purine and pyrimidine synthesis. So I'm just writing DNA synthesis. DNA synthesis. So if there is a defect in decreased DNA synthesis, what happens is an asynchrony. Can anybody tell me what is this asynchrony? Nucleoside, yes. Nucleocytoplasmic asynchrony. Nucleocytoplasmic asynchrony. Okay. Why? Because nuclear development is normal, but cytoplasm is not properly, sorry, nuclear development is less, but cytoplasm is properly developed. So that is why nucleocytoplasmic asynchrony. So what about B12 deficiency? If there is B12 deficiency, what will happen? N5 methyl THFA cannot be converted to THFA. Am I right? We have seen that reaction N5-methyl to THFA. So if there is a B12 deficiency, tetrahydrofolic acid is also reduced. So this is going to reduce the THFA as well. What is this called as? This is called as folate trap. Folate trap or THFA starvation. This name is given in Harrison. THFA starvation. So THFA starvation or folate trap. So what will happen? The same thing, right? Same thing. So what is the clinical feature of B12 deficiency? Here also we can get megaloblastic anemia. Plus, what is so what is peculiar about B12 is, yes, you're right, ARS57. എനിക്ക് ആ പേരൊന്ന് കിട്ടണം കേട്ടോ. ARS57 ആൻഡ് ക്രിസ്റ്റീന, ഞാൻ നിങ്ങളെ ചേർത്തിട്ട് ഒരു സാധനം ഉണ്ടാക്കാൻ പോവാണ്. ഓക്കെ, പ്ലീസ് മെസ്സേജ് മീ. എൻ്റെ നമ്പർ ഉണ്ടല്ലോ അല്ലേ? Okay, so megaloblastic ഇന്നലെ തന്നെ വേണമായിരുന്നു. Okay, you please message me ARS57. I was searching for who is that. So please message me personally and also Christina. Okay, so megaloblastic anemia plus SACD, that is subacute combined degeneration. So that is the clinical features of these two. So investigation also I have told you. So this is how we differentiate between. Now, that what we have learned is orange. Orange. Orange കൊടുക്കാനാണോ അല്ലേ? Yes. Parcel ആയിട്ട് വിടാനാ. Okay, so just see what is the difference between B9 and B12. Very, very important. Every topic, every point I have covered here. Even though ഞാൻ കുറച്ച് തമാശ രൂപത്തിൽ പറഞ്ഞെങ്കിൽ പോലും it is very, very important. Yes, thank you. So green leafy vegetable, animal products, who is prone to develop, then enzyme differences in these two, investigation, these two, what is the difference, then both are having megaloblastic anemia, but one is having neurological deficits as well. Okay. So I'm going from here. Now we have to learn only one more thing in the sulfur containing, that is about glutathione. Glutathione. Glutathione is made up of three amino acids. That is there in the name itself. One amino acid is glutamic acid. Then thio, whenever we say, it is something related to a sulfur containing amino acid, and here it is cysteine. Then you can see one here. One is the simplest amino acid, glycine. So which are the three amino acids in glutathione? Neurotransmit, yes, neural tube defects. It is because, DNA synthesis require folic acid, right? So because of that, it can affect the brain development in the early stages. That's how. And folic acid supplementation is necessary in all the stages. Like prenatal, it is causing neural tube defects. That is also important in the different stages of critical stages of brain development. Like folic acid is required. The second stage of critical stage of brain development is the puberty. The third stage is the midlife, that is around 40 and 45. So if we are not taking proper nutrition in these three phases, what will happen? Various stress disorders or autism, all these things that these children are having is because of folic acid deficiency and all nutritional deficiency in the prenatal. Stress in the prenatal, that's a big story. അതിപ്പോൾ നമ്മൾ പറഞ്ഞാൽ തീരൂല. Okay, fine. Coming back, which are the three amino acids in glutathione? Yes. GLU stands for what? GLU stands for glutamic acid. Correct. Okay. So these are the three amino acids here. Now, this is a pseudopeptide because it is not a true peptide bond. It's a pseudopeptide. And what are the functions of glutathione? Number one, free radical scavenging. This reaction I've already told you. Free radical scavenging. Hope you remember this reaction. H2O2 is converted to H2O. So during this reaction, GSH is converted to GSSG is coming back. NADPH is required here and NADP plus is formed. What are the two enzymes here? ഞാൻ already പറഞ്ഞതാണ് that HMP ലൊക്കെ ഞാൻ പറഞ്ഞതാണ്. Okay, which are the two enzymes here? Yes, peroxidase and glutathione reductase. Correct. Glutathione peroxidase and glutathione reductase. I'm not explaining this, okay? So that is a free radical scavenging. Then glutathione is required for conjugation reaction. This is actually a xenobiotic. Xenobiotic is foreign substance in detoxifying reactions which happens to the foreign substances that we are eating or taking through our diet or any other sources. So that is glutathione is required for that. Then it is a coenzyme. It can act as a coenzyme. Then another important thing about glutathione is amino acid transport. These are all the functions of glutathione. I'm not explaining anything. That is most of this, free radical scavenging is the most important thing here. Okay, so that is about sulfur containing amino acid metabolism. So to conclude, what all things we have learned is, I'm just going to conclude everything. So what we have learned is, we have learned about the differences between cysteine and homocysteine. Then we learn about this metabolism. Metabolism, no need to learn, but learn the homocysteinuria as well as the non-classic homocysteinuria. Then here I just told you about primary hypermethionemia. There is a boiled cabbage smell. Just learn that. Then homocysteinuria, no need to say. It is very, very important. Everything we have learned in homocysteinuria is very, very, very important. So I'm just skipping there because you have to learn everything. Then what we have learned is about cystinuria. It's a previous year question. Cystinosis ഇതുവരെ ചോദിച്ചിട്ടില്ല കേട്ടോ. So cystinuria has been asked, but not cystinosis. Then this is also a previous year question. Last NEET, this was a question. Cystinuria hexagonal crystals. Then B9 and B12. Please learn everything about B9 and B12. So I have covered B9 and B12 here. Then glutathione. In the glutathione, which are the three amino acids? Very, very important. Then what are the functions? Just know the name, that is enough. Okay. So this is how we have to learn sulfur containing amino acid metabolism. We give you a break. എന്ത് ചെയ്യാൻ പോവാ? Grab a snicker. എൻ്റെ കയ്യിൽ ഇവിടെ കുറച്ച് സാധനങ്ങളുണ്ട്. ആർക്കെങ്കിലും വേണോ? കാണാം. Congenital hyperbilirubinemia. What I will do is congenital hyperbilirubinemia. I will write a note and send it to you. Is that okay? ക്ലാസ്സിൽ എടുക്കാൻ സമയം കിട്ടുമോ എന്നറിയില്ല. ഒറ്റയ്ക്ക് തിന്നുന്നില്ല, പക്ഷെ എനിക്ക് വിശക്കുന്നു. ബിക്കോസ് ദിസ് ഇസ് മൈ ഡിന്നർ ടൈം. അയച്ചു തരാം. DNA hybridization and PCR note അല്ലേ? I'll send. ഓക്കെ, എന്നോട് ചോദിച്ച ചോദ്യം പോർട്ട് വൈൻ സ്റ്റെയിൻ ഇൻ PCT, right? Port wine stain in PCT is because porphyrins are excreted, right? I told you porphyrinogens are colorless, but porphyrins are colored. So porphyrinogen, uroporphyrinogen can get converted to uroporphyrin. So once it gets converted to uroporphyrin, then it is colored compound. So that is why there is port wine stain or color of urine. And whenever there is porphyrias, there is high colored urine. All of you take this notes. കയ്യിലുണ്ടോ? Okay. So this is we are going to learn all the other amino acids very quickly. So first glycine, it is the simplest amino acid. Essential glucogenic and all. I'll give you the list of essential and glucogenic and all. So now you don't have to worry about it. This is one thing that you should learn. That is, glycine is optically inactive because glycine has NH2 here, COOH here, H here, H here, which means what is the peculiarity of this carbon atom when it is compared to the other? Who will tell me? Yes, 2H means no chiral carbon. Or I can also write there is no asymmetric carbon. Okay. That is why it is optically inactive. There is no isomer, which means there is no D-glycine and L-glycine. It is only glycine. Okay. Now we'll see some of the compounds from which glycine is derived from. From serine. This reaction I have told you along with urea cycle. Urea cycle, I told you that glycine can conjugate benzoate, sodium benzoate. And what I said, it is excreted as benzoyl glycine. So when it is excreted as benzoyl glycine, yes, hippuric acid. So what is being scavenged? Ammonia is being scavenged. So this reaction is glycine synthase. ഇതൊന്നും പഠിച്ചില്ലേലും that's okay. Just understand. So benzoate is going to conjugate glycine. So when glycine is conjugated, ammonia is being used. Now learn about this one, that is glyoxylate. From glyoxylate, what is glyoxylate? Can anybody tell me or guess and tell me what is glyoxylate? One clue I'll give you. It is like the relationship between alanine and pyruvate. Or aspartate and oxaloacetate. So what is glyoxylate to glycine? Yes, it is the keto acid. Keto acid. Okay. So from that keto acid also glycine can be produced. I'm not saying anything here. What are the compounds that are derived from glycine? Number one, it is purine. Purine, in the purine, which all atoms are contributed by glycine? C4, C5, N7. Even if you forget that, it's fine. Then glycine can form creatinine. This we'll be learning separately. Heme we have learned, that is glycine, the first substance that we, glycine plus succinyl coenzyme. Yes. Serine glycine is like interconvertible. Glycine can be converted to serine, serine can be converted to glycine. Then it is a neurotransmitter. You know, glycine is a neurotransmitter. Then it can conjugate bile acid. With whom? Glycine plus? Yes, tell me. Glycine plus? ഇപ്പോൾ നമ്മൾ പഠിച്ച ഒരാളാ. That is, who can conjugate bile acid along with the glycine? Yes, taurine. 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 Okay. So that is about glycine. In this, what you have to learn is what are the compounds derived from glycine. Purine, heme, then glutathione. Glutathione we have seen now. Glutamic acid, then sulfur containing amino acid and glycine. Okay, so these are the compounds. It is very, very important. Please do learn all the names. Plus, it is a recurrent amino acid in collagen. Here you write glycine is the most abundant amino acid in collagen? And we can see it as glycine XY repeat. Glycine XY repeat, which means it is a recurring amino acid. ഈ terms ഒക്കെ നിങ്ങൾക്ക് question വരാം. It's a recurring amino acid. It's the most abundant amino acid in collagen because in collagen you can always see glycine XY. Again, glycine XY. Every third amino acid is glycine in the case of collagen. Okay. So this was asked in one of the exam. The exam, one of the option was like this. In collagen, the most abundant amino acid is phenylalanine. No. In glycine, the most in collagen, the most abundant amino acid is. Yes, tell me. In collagen, the most abundant amino acid is glycine, glycine, glycine. Okay, fine, good. Now going to creatinine. No need to learn this pathway. I have just shown you this pathway to understand that there are three amino acids involved in the synthesis of creatinine. So the first one is glycine. Second one is arginine. And the third one, I'll tell you. So the first glycine and arginine, it becomes guanidinoacetate. Then it becomes creatine. So for this reaction, S-adenosyl methionine is converted to S-adenosyl homocysteine. So which is the amino acid here? Third amino acid here is methionine. Okay. No need to learn everything. Just learn GAM. Glycine, arginine and methionine. That is for the synthesis of creatinine. Understand that? That is enough. So I'm moving from here. Then what is primary oxaluria? Primary oxaluria means the conversion of glyoxylate to glycine. Along with that, what we can see is alanine is converted to pyruvate. Who will tell me what is this reaction called as? Glyoxylate to glycine, alanine to pyruvate. What is the reaction called as? Yes, transamination. Very good. Very good. Transamination. Oh, nalla makkalu. So this enzyme is called glyoxylate, alanine, amino transferase. Glyoxylate alanine aminotransferase. Okay. So if this is glyoxylate alanine aminotransferase, now you have to tell me what is the vitamin required here? Yes, correct. What is the vitamin required here? Chadeyenu varano. Tell me. What is? Yes, PLP. So this require PLP. So if there is a deficiency of this enzyme, glyoxylate accumulate. So glyoxylate accumulate means finally this is getting converted to oxalate stones. It goes, so that is why it is hyperoxaluria. It causes oxalate stones. What is the shape of oxalate stone in the microscopy? In microscopy, it has, this is the shape. What is that? Mulberry. Ayyo, Allah. Envelope. Correct. Yes. Yes. Envelope shaped crystals. Which means one vitamin deficiency can cause oxaluria. Which vitamin deficiency will cause oxaluria? Tell me. One vitamin deficiency. Yes, very good. So B6 deficiency can cause oxaluria. One vitamin toxicity can cause oxaluria, and that is vitamin C toxicity. Vitamin C toxicity, one vitamin deficiency, B6, vitamin C toxicity can cause oxaluria. Okay. So if there a case of B6 deficiency can be given and in the urine microscopy envelope shaped crystals is given, it means that it is oxaluria. Okay. This can be a image based question for you. Then coming to serine. Serine has many products. One is serine on decarboxylation, gives ethanolamine. Then from this we'll get choline and BT. Just know that name. You don't have to learn this pathway. No need to learn that. Just learn dumbbell. Dumbbell is also shape of oxalate stones. Okay, I'm not sure. Okay, so serine has ethanolamine, choline, and then beta. Just learn that. Selenocysteine. Selenocysteine I'll take separately. Sphingosine is derived from serine. Sphingosine is serine plus palmitic acid. Then phosphatidylserine. So these are all the compounds derived from serine. Okay, I'm not taking much time there. Next we go to branched chain amino acids. Branched chain amino acid, ഇത് ഞാൻ പറഞ്ഞുതരാം. No need to learn this. I will help you to learn all are essential, all are non-polar, etc. I'll tell you later. The three basic reaction of every branched chain amino acid is, the first thing is it undergo transamination. Then the next reaction is, I will write the reaction. You have to tell me the name of this enzyme. Carbon dioxide is released. NAD plus is converted to NADH. What is this enzyme called as? Who will write? Oxidative decarboxylation. That enzyme is dehydrogenase. Yes, that is branched chain keto acid dehydrogenase. Branched chain, yes, BCKD. Branched chain keto acid dehydrogenase. Okay. Now it becomes acyl coenzyme, and later on many reactions you need not learn that. Okay, now we are coming to a defect in this. If there is a defect in branched chain keto acid dehydrogenase, it causes maple syrup urine disease. Maple syrup urine disease, very important. So we are going to learn about maple syrup urine disease. The defect is in BCKD. Now you remember about this is similar to whom? BCKD is similar to whom? Pyruvate dehydrogenase. Okay. So how many enzymes are there? Yes, three enzymes. E1, E2 and E3 is common. Okay, E2 and E3 is common. What is E1 here? It can be either branched chain keto acid decarboxylase. Also, we can write branched chain keto acid dehydrogenase. Or branched chain keto acid decarboxylase. Okay. ഇവിടെ ഒരു difficult സാധനം I have written. The types of MSUD. It is very easy actually. So I told you there are three enzymes, E1, E2, E3. E1 can be a product of two genes, E1 gene or E1 beta. So if there is a defect in E1, it is a product of two genes, E1 alpha or E1 beta. So if there is a defect in E1 alpha, it causes type 1A MSUD. If there is a defect in E1 beta, then it causes type 1B. If there is a defect in E2, now tell me what is this? If there is a defect in E3, what is this? You have to tell me. If the defect is in E1 alpha, E1 gene, E1 enzyme is a product of two genes, E1 alpha or E1 beta. So E1 alpha defect, it causes type 1A. E1 beta defect, it causes type 1B. This was a question asked in one of the exam. E1 beta defect causes. That is why I am saying this. Yes, E2 is type 2, E3 is type 3. Correct. E2 is type 2, E3 is type 3. Okay, that is it. Now, how they present with? They present with all the features of neonatal disorders. Poor feeding, failure to thrive, failure to gain weight, seizures, coma, all these things are there. Plus, what is peculiar about this? This is important. Metabolic acidosis. Why? Because the branched chain keto acids accumulate. So there is metabolic acidosis. Then another very important feature is they are having hypotonia, which is alternating with hypertonia. So because of that, these children, they have some involuntary movements like kicking and boxing type of movement. So that is kicking or boxing type of movement. Then what is the disorder? What is the order that you can get? Maple syrup, burnt sugar, or caramel order. Okay, so these are the most important thing. Now the rest is very easy to understand. Urinary excretion of branched chain amino acid, because branched chain keto acid, finally the other one can also accumulate. Branched chain amino acid or keto acid. DNPH test is positive. DNPH test is positive. Now I'll ask you another question. ഞാൻ കുറേ ടെസ്റ്റുകളുടെ പേര് പറയാം. You have to tell me what is the disorder. Ferric chloride test. മറന്നുപോയോ? Ferric. PKU and alkaptonuria. Very good, very good. Cyanide nitroprusside test. Homocystinuria. Okay. Now, ഇവിടെ നമ്മൾ വേറൊരു test is learning, that is DNPH test. DNPH test is positive. DNPH test, how will it looks is, it has yellow color. It looks yellow. Rotheras test is also positive. Actually, Rotheras test is a test for what? Ketone bodies. Okay. But this branched chain keto acid can also answer Rotheras test positive. Okay. So what is the treatment that we can give? Yes. Treatment that we can give is we have to restrict branched chain amino acids and we have to give thiamine. Why we are giving thiamine? What is the biochemical rationale of giving thiamine here? Who will tell me? Why we are giving thiamine? Yes, thiamine pyrophosphate. Yes. Why we are giving thiamine? Yes, even enzyme require. Very good, very good, very good. Oof. So sweet of all of you. Good, good. ഞാനിപ്പോൾ അവിടെ ഉണ്ടായിരുന്ന എത്ര ഓറഞ്ച് തന്നേനെന്ന് എനിക്കറിയില്ല. എനിക്ക് ഓറഞ്ച് തരാൻ വഴിയില്ലല്ലോ. ഓക്കെ. Showers of oranges and apples. Right? Good, good. Okay. മനസ്സിലായല്ലോ. Okay, fine. Now we go to arginine. Arginine. Yes, yes, right. Okay, so now we are going to arginine. Arginine is the most basic amino acid. ഇതൊക്കെ പണ്ട് ചോദിച്ചിരിക്കുന്നു. Like before 5 years, these were the questions. But nowadays, those questions are not. GPay തന്നാ മതിയെന്ന്. Oh, bada. Okay, tell me your number. I'll give GPay. എന്ത് സ്കാം? മണാലി ലേയിങ് ഇല്ല. എന്ത് സ്കാം എന്താടാ? What is it? Technoboa is male or female? I don't know. He or she, I don't know. Scam, ma'am. What? Okay, okay. Okay. ഓ, ജിപേ കൊടി ആ കൊടുക്കല്ലേ എന്നല്ലേ? ഓക്കെ ഓക്കെ, ഞാൻ കൊടുക്കൂല. ഇൻസ്റ്റാമാർട്ട് മതി. ഓക്കെ, ശരി, ഇൻസ്റ്റാമാർട്ട് മതി. സ്വിഗ്ഗിയിൽ ഞാൻ എന്താ വാങ്ങി തരണ്ടേ? മന്തി, ബിരിയാണി, ഓക്കെ, അൽഫാം. എൻ്റെ അമ്മോ, ഞാൻ കുത്തോളം എടുക്കില്ല. Why we supplement B1? Okay. We supplement B1, it's because branched chain keto acid is similar to pyruvate dehydrogenase, right? So that enzyme, there are 5 coenzymes for branched chain keto acid dehydrogenase. So branched chain keto acid dehydrogenase, there are 5 coenzymes. Which are the 5 coenzymes? One is B1. Okay. So one is B1, thiamine. Then the next one is coenzyme A, then FAD, NAD, then lipoamide. Okay, so out of that, E1 enzyme is the most common defect, and E1 enzyme require thiamine. So that is why we give thiamine. E1 enzyme require thiamine. So whenever there is an enzyme defect, we try to supplement the coenzyme or the cofactor. So that is why. Samsung, understood? Okay, right, correct. Now coming to arginine. അർജുനൻ പറഞ്ഞപ്പോഴാണ് ഞാൻ ഓർത്തെ എൻ്റെ മകൻ ഇപ്പൊ പറയുന്നു മെസ്സി വരുന്നുണ്ട് കേരളത്തിൽ നിന്ന്. അത് കറക്റ്റ് ആണോ? ആൻഡ് ഹീ സേയിങ് ദാറ്റ് ഐ ഷുഡ് ബുക്ക് ടിക്കറ്റ്. ശരിക്കും വരുന്നുണ്ട്? ഓക്കെ ഫൈൻ. റൈറ്റ്. Come back. Arginine, arginine is the most basic amino acid. Okay. And it is the most polar amino acid. അതൊക്കെ വിട്ടേരെ. That were questions. ശരിയാണ്. Okay. ശരിയാണ്, ചുമ്മാ അല്ല. എൻ്റെ മോൻ അവിടെ എവറി ഡേ വെയറിങ് only മെസ്സി jersey and saying that Messi is coming. He is very excited to see him. Okay, so what are the products? You don't have to learn all these things. Most basic. അങ്ങനത്തൊക്കെ nowadays not asked. The metabolic products from arginine. Or from arginine we know urea is formed. അല്ല, urea is formed. പറയാം. Urea is formed. Ornithine is formed. Okay, ornithine, urea. എവിടെയാ ഉണ്ടാവുക? Which cycle we have learned that? Yes, urea cycle. Okay. Then creatinine. What are the 3 amino acids in creatinine? All of you, please tell me. Yes, urea cycle la kandu. 3 amino GAM. Correct. Glycine, arginine, methionine. So there also we have seen arginine is there. Plus, this is the most important thing that you have to learn. Nitric oxide is derived from arginine. If you forget everything else, that's fine. Please don't forget this. Nitric oxide is derived from arginine. Very important compound derived from arginine. Okay. Next, we go to histidine. അത്ര പഠിച്ചാൽ മതി. Histidine. Histidine also, I have given a lengthy pathway. No need to learn that. But we have to learn something here. That is this reaction. Here you can see THFA is coming and it becomes 4-mimino THFA. Okay. So if there is a deficiency of, if THFA deficiency is there, or B9 deficiency is there, what will happen if B9 is deficient? Who is excreted here? Yes. If B9 is deficient, who is excreted? Fig glue is excreted. That is what I said early. That is fig glue excretion. I'll explain later. That's B9 deficiency. Fig glue is excreted. So this test is called test for B9 status is histidine load test. Histidine load test. Histidine load test is a test for B9 status. Okay, so that is only whenever you are learning, you don't have to learn everything. I'm just highlighting few things. No, histidine ആകെ നിങ്ങൾ പഠിക്കേണ്ട ഒരു കാര്യം എന്ന് വെച്ച് കഴിഞ്ഞാൽ it is this is then, that is fig glue is excreted. It is related to B9 deficiency that is asked. So that is why we are learning. And then whenever there is hemoglobin is a buffer, albumin is a buffer, who is contributing to the buffering action? It is the imidazole ring of histidine. That name, that also you should know. Imidazole ring of histidine is contributing to the buffering action. Okay. So now you take a separate, ഇതിനകത്ത് സ്ഥലം ഉണ്ടാവില്ല. So you can take a separate note and I will just conclude the entire amino acid in few things are remaining. So that is what I'm going to do. So first thing is about selenocysteine. Did I tell you about selenocysteine? Which are the enzymes that require selenocysteine?
Yes.
Yes. Okay. So glutathione peroxidase, thioredoxin reductase, then deiodinase, and selenoprotein P. These are the enzymes. Now, the selenocysteine is derived from an amino acid. That is, it's a precursor amino acid is serine. And this amino acid is coded by a stop codon. And that stop codon is UGA. So this is considered as the 21st protein forming amino acid. 21st protein forming amino acid. So to learn this precursor amino acid and all, I'll give you a simple way to remember. Serina's sister Selena coming from Uganda. You remember, for the selenocysteine, the precursor amino acid is serine and the codon is UGA. Okay. You go away. Yeah. You go away. Correct. UGA is you go away. Right. Should I go now, Jeevan? Okay, fine. So then I will just tell you about the other amino acids which are purely ketogenic, purely glucogenic. Is it possible to synthesize? Yes, yes, yes. It is there. Glutathione. That is why glutathione peroxidase, thyrodoxine reductase, deiodinase, these are all human enzymes. It can be synthesized in human. Yes. Okay. Okay, so I think that is clear. Now we are going to see the amino acid classification. Not in detail. We have learned about certain amino acids are purely ketogenic. Both ketogenic and glucogenic. Purely glucogenic. So purely ketogenic amino acid only two. Lysine, leucine. Only two, lysine, leucine. Both ketogenic and glucogenic amino acids, you learn it as PIT. PIT, in that P stands for phenylalanine, I stands for isoleucine, T stands for tryptophan, and again one more T is there, that stands for tyrosine, which means out of this, three amino acids are aromatic amino acid, PTT. They are aromatic amino acid. Only one branched chain amino acid is there, and that is isoleucine. Now, purely glucogenic are, you just learn all others. Very simple to learn. Okay, so PIT, leucine, lysine, then all others are glucogenic amino acid. It's very easy to learn. After this, I will just tell you the code word to learn essential amino acid. Do you have any mnemonic to learn essential amino acids? Okay, private Tim Hall, right. Il MP take 3 white. Il MP take 3. Okay, il MP TV till 8 p.m. Okay. Oh, so many mnemonics I'm getting. Il MP take 3 vitamin. Il MP methionine, phenylalanine. TT. Okay, we'll see. I used to learn it like this. Met will fly. Met will fly. So you can learn whichever mnemonic you are thorough with. You don't have to learn this. This is my way. That is methionine, threonine, tryptophan. Will is the branched chain amino acids. So all branched chain amino acids are essential. This stands for phenylalanine. LY stands for lysine. These are the plus. Add histidine and arginine. Out of this, arginine is considered as semi-essential. Arginine is considered as semi-essential. Okay. So these are the essential amino acids. Polar, non-polar veno. Which are the polar amino acids? Polar amino acids are very easy to remember. First learn A, B, C. A, B, C are polar. This is what we are learning first. A, B, C are polar means acidic and basic amino acids are polar. That is, acidic and basic amino acids are, C stands for charged. Acidic and basic amino acids are charged and charged amino acids are polar. That's the first thing you learn. Acidic amino acids are aspartic acid, glutamic acid. Basic amino acid is Hall. Hall stands for histidine, arginine, lysine. So these are the 5 charged amino acids which are polar. A, B, C. Very easy. A, B, C if you learn, 5 amino acids are polar is clear. Then which are the other amino acids? There are uncharged amino acid. ഇവിടെയാണ് trick ആവുന്നത്. Uncharged amino acids are also there which are polar. Number 1, it is the hydroxyl group containing amino acid. That is serine plus threone. Number 2 is amides. Amides is glutamine plus asparagine. ASN is asparagine. That is the other one is glutamine. Then in the sulfur containing amino acid, we can write here only cysteine. Only cysteine. Then simple amino acid, only glycine. Only glycine. So these are the polar amino acids. So ABC is very easy to learn. Then hydroxyl group, hydroxyl polar ആണെന്ന് ഓർത്തിരിക്കാൻ it's easy. Amides, that is asparagine and glutamine. Then sulfur containing only cysteine, simple only glycine. All others are non-polar. Non-polar, all others. Okay, so that is about the polar and the non-polar. Tyrosine. Okay, tyrosine I will tell you. Tyrosine has group ഉണ്ട്, but tyrosine is having hydroxyl group, but still it is covered under non-polar in Harper. According to Harper, it is classified as non-polar. So all aromatic amino acids are non-polar except one, that is histidine. So that charged and uncharged is a different property. അത് ഞാൻ ഇപ്പൊ പറയാൻ നിന്നാൽ തീരൂല. Hydroxyl group. Yes, tyrosine has hydroxyl group, but it is not considered as polar. It is considered as non-polar, but still it has some polar nature. If you can personally message it, Christina, I will explain, okay? കാരണം ഇപ്പൊ തീരൂല പറഞ്ഞു കഴിഞ്ഞാൽ കുറേ ഉണ്ട് പറയാൻ. I have to say a lot. So it won't finish now. Okay. So that is about the simple amino acid. ഇനി നമുക്ക് കുഞ്ഞു രണ്ട് ടോപ്പിക് കൂടെ ഉണ്ട്. Glycosaminoglycans. Not so very huge. It's very small. Then recombinant DNA technology. So with that, we'll finish. So I'll give you a short break. ഓക്കെ, നമുക്ക് വേഗം തീർക്കാം. Glycosaminoglycans. This is there in your notes. Please see that. So what is glycosaminoglycans? Glycosaminoglycan is something which is in my hand, something like this. So what is glycosaminoglycan is? It is something like this, where you can see one type of bead, again another type of bead, another type of bead, like that. So it is like it is a polysaccharide where one disaccharide unit is repeated one after the other. So just like this, what I am showing, glycosaminoglycan is a long, so unbranched. So there is no branches here. There is no branch here. It is unbranched, okay, with a repeating disaccharide unit. So what is this disaccharide unit? One unit is, it's an amino sugar. Amino sugar means you have heard about glucose, galactose, etc. So when it is combining with an amino group, we call it as galactosamine, glucosamine, etc. So that is an amino sugar. Then what is an acid? Acid means second component is an acidic sugar. Acidic sugar. Acidic sugar means when glucose is oxidized, or fructose is oxidized, or any carbohydrate is oxidized, the corresponding sugar acid is formed. So that is called as acid. That is, glycosaminoglycan is made up of amino sugar plus an acidic sugar. So acidic sugar can be glucuronic acid or iduronic acid. Now I'm going to tell you something, that these glucose amino means it is having actually a positive charge. It is having a positive charge because amino is having a positive charge. So there is a positive charge here. But what will happen to this glucosamine? Some negatively charged compounds are attached. For example, to this sulfate groups are attached, or CH3COO minus group is attached, which means acetyl or sulfate groups are attached to this amino sugar. So what will happen to this amino sugar is it is becoming negatively charged. So glycosaminoglycan is having amino sugar, but to this amino sugar, the sulfate and acetyl group is attached. So because of that, it is having a negative charge. Plus, the second unit is an acid. Acid means there is COO minus. It is COO minus. COO minus, which means again negative charge, which means in the glycosaminoglycan that the charge that you can see is negatively charged. Okay. Now, what we should know is glycosaminoglycans are like some of our departments. You see gynecology department. It is full of males or females. Tell me. Most of the time. Gynec department. Okay, female predominant department. Ortho, male. Okay. So how is the harmony there? Males usually. Okay. What is the harmony of among the gynecologists in the gynec department? Do they agree each other? In ortho department, one orthopedician doesn't like the other person's technique, right? So no, never. Yes. So toxic departments are mostly single gender department, right? Likewise, the glycosaminoglycans are also like that. It is having only one charge. That is, it is predominantly, all are mathematics, correct. So it is predominantly negatively charged. Okay, it is predominantly negatively charged so that it is repelling each other. So one gynecologist doesn't like another. Biochemistry department is not like that, okay? So biochemistry department is we have both males and females. So we don't have much fights in our department. But one single gender, then there is fight. Likewise, glycosaminoglycans are ortho department or a gynec department. So that is why I can walk like this. Okay, why I can usually in the class okay, but still so why I can walk like this? It's because my joints are rich in glycosaminoglycans. Okay, that is why the joints are okay, the joints are mobile, right? Now, what about so the joints? So after some time, what will happen? The one of the most important supplement that you provide or prescribe in ortho posting was true joint and all. You have supply, you have prescribed for your patients. Chondroitin sulfate. Yes. What is chondroitin sulfate? It is a glycosaminoglycan. So that joints are mobile because of this negative charge repelling each other. Likewise, mucus secretions. Secretions are slippery. Why it is slippery? Because the negatively charged glycosaminoglycans are very commonly seen inside the mucus secretion. And that is the reason why glycosaminoglycan is also called as mucopolysaccharides. Mucopolysaccharides, because that is the polysaccharide richly present inside the mucus. Okay. So they are negatively charged. Once they are charged, they are always ready to absorb water. All the charged component can absorb water, which means this is the one which is giving the cushioning effect to your joints. See, if you sit down, നിങ്ങൾ വെറുതെ ഇങ്ങനെ ഒന്ന് സിറ്റ് ഡൗൺ ചെയ്ത് നോക്കി കഴിഞ്ഞാൽ പട്ടേ പട്ടേ എന്ന് സൗണ്ട് കേൾക്കാമോ? Can you hear some cracking sounds? If you are hearing the cracking sounds, means that the glycosaminoglycan content in your yes, yes. Okay, so usually it won't happen. It's usually tappe tappe, yes. Usually it won't happen because the glycosaminoglycans is absorbing water. It is giving a cushioning effect to your cartilages and the bones. But once the glycosaminoglycan content is reduced, that cushioning effect in these joints are reduced. That is why pain happens and all. Okay, that smooth functioning of the joints won't take place. Okay, so just to understand, they are negatively charged and hence the joints are mobile and they can absorb water. So that is why they are having a cushioning effect. Okay, now which are the different glycosaminoglycans? Different. ടപ്പേ ടപ്പേ ആയപ്പോ ചാവാറായി. എന്ത് ചെയ്യാനാ? ഓക്കെ, ഫൈൻ. റൈറ്റ്. സോ വിച്ച് ആർ ദ ഡിഫറെന്റ് ഗ്ലൈക്കോസമൈനോഗ്ലൈക്കൻസ്? എങ്ങനെ പറഞ്ഞ് പേടിപ്പിക്കാതെ. Okay, so which are the different glycosaminoglycans? Starting from chondroitin sulfate. എന്നോട് പറഞ്ഞില്ലേ R57? എന്നോട് ഇതുവരെ പേര് പറഞ്ഞില്ല. Who is R57? Okay, so പറഞ്ഞില്ലേ, you told me that chondroitin sulfate, right? Chondroitin sulfate is the most abundant glycosaminoglycan. Where is it present? It is present in the bone and in the cartilage. Bone and the cartilage. പിന്നെ കുറച്ച് തലച്ചോറിലുണ്ട്, CNS. But remember, bones and cartilage has chondroitin sulfate and this is the most abundant glycosaminoglycan. Okay, that is clear now. Now keratin sulfate. Kerata. It tells you something. What is that? Kerata always stands for something related to cornea, right? Cornea. Yes. So keratin sulfate is first isolated from cornea. Okay. Next, you remember, whatever I'm highlighting is what you have to learn. It is required for the corneal transparency. This is a previous year question. Okay. Previous year question. Corneal transparency. So cornea, whenever we say that name kerata should be in your mind. So keratin sulfate is in corneal. It is responsible for corneal transparency. Then another peculiar feature is it doesn't have that uronic acid. That is, acidic sugar is not there. Instead of that, it contains galactose. That's a different. Then most heterogeneous and you'll just leave. So instead, there is no uronic acid. Instead of that, what you can find is galactose in the case of keratin sulfate. Now going to dermatin. That name is telling you where is it present. Dermatin. Where is it present now? Skin, yes, yes. So that is dermatin in dermis, plus white of the eyes, that is sclera. Present in sclera and dermis. Okay. That is dermatin sulfate. Cornea, tell me, cornea. Which glycosaminoglycan? Kerata. Okay. Sclera, sclera, dermata. Okay, fine. Dermata. Sclera, dermata. The other one is kerata. Okay, fine. Now, heparin sulfate. Heparin sulfate is why albumin is never found in urine. It's because I am albumin, okay? I'm coming and walking and coming to glomerular basement membrane. I'm getting repelled. Again, I'm coming to glomerular basement membrane to get excreted, but glomerular basement membrane will not allow, repel me. Why? Why this glomerular basement membrane is repelling me? It has a glycosaminoglycan. Other reasons are also there. It's molecular weight, podocyte and all. But I'm just telling about the glycosaminoglycan part. Yes, light charge repel me, right? So the same thing is happening here. The who is giving the charge selectiveness to glomerular basement membrane? That is what you have to learn. Most important. Charge, this is a previous year question. So whatever I'm highlighting is the previous year question. The rest is optional to you. So charge selectiveness is because of heparin sulfate. Then most of them are plasma cell receptors. Then another thing is it is the one which anchor lipoprotein lipase. Where is lipoprotein lipase present? In the vascular endothelium. Vascular endothelium. Right, right. Then heparin. Heparin is a glycosaminoglycan, and what is the peculiarity of it? It is an anticoagulant that you all know. Then coming to hyaluronic acid. What is peculiar about hyaluronic acid? I'll tell you. You know, if you go and tell to another person, mostly it is my gender. Sorry to say that, but still it's like that. We are like that. So if you say to another person and say that, don't say this to anyone. It's a top secret. Don't say this to anyone. Then the next second, what will happen? He or she will go to the next person and spread the news and say that, don't say this to anyone. Same thing. The hyaluronic acid is almost similar to this. Hyaluronic acid is somebody who is considered as the, what you say, or the channel reporter in our body is hyaluronic acid. Channel reporter, channel reporter in the, or what you say, British Broadcasting Company of our body is hyaluronic acid. Why? Because hyaluronic acid, yes, hyaluronic acid helps in cell migration. Wherever cell migration, Kudumbasri, correct. Wherever cell migration is there, then hyaluronic acid is equivalent to Kudumbasri. Correct. So that is hyaluronic acid. The most important thing that you should learn here is it is required in the process called as cell migration. We know cell migration is required for embryogenesis, tumor metastasis, wound healing, where inflammatory cells migrate. So whenever cell migration is there, who is there? Milan or BBC? Okay. Whenever cell migration is there, who is there? Hyaluronic acid. Okay. Now I'm going to ഒരു rapid fire session ആണ്. ആരാണ് ആദ്യം പറയുന്നത് നോക്കട്ടെ. I'll tell you a function. You have to type the answer. Okay. Charge selectiveness of glomerular basement membrane. Heparin sulfate. Okay, okay. ആരാ ആദ്യം? Okay. ടെക്ന. ടെക്നോപോ രണ്ടെണ്ണം എഴുതി. ഓക്കെ ശരി. കറക്റ്റ്. ആ റൈറ്റ്. റിയ ജോർജ്. ഇന്നലെ ആർ ജോർജ് വന്നതാണല്ലേ റിയ ജോർജ് ഇന്നായത്? ഓക്കെ കറക്റ്റ്. ഹെപ്പാരൻ സൾഫേറ്റ്. ഓക്കെ. കോർണിയൽ ട്രാൻസ്പെറൻസി. കറക്റ്റ്. കെരാട്ടൻ സൾഫേറ്റ്. ആരാണ് ആദ്യം എഴുതിയത്? ഓക്കെ ക്രിസ്റ്റീന. ഓക്കെ ഗുഡ് ക്രിസ്റ്റീന. ദെൻ സ്ട്രക്ചർ ഓഫ് സ്ക്ലീറ. Dermatan. Correct, correct. Midun, good. Then anticoagulant. Heparin, good, good. Techno, pova. Uff, ധാരാണോ ഇത്? Then another question. Charge selectiveness. Okay, അടുത്ത question ഏതാ? Um, cell migration. Yes, yes, yes. Correct, correct. Right. Technopova, CH, all good. Okay. So I hope that is clear. Now we go to what is called as proteoglycan. പേര് കേൾക്കുമ്പോൾ you feel that it is very difficult, but it is not like that. It is very easy. Proteoglycan means it is glycosaminoglycan, which is a carbohydrate combining with the protein. That is a proteoglycan. So they have a shape like this. It is a bottle brush shape. Bottle brush shape where this stalk you can see in the center. This is a protein. And here what you can see is the glycosaminoglycan. So glycosaminoglycan attached, covalently attached to protein is called as proteoglycan. Okay. Now we are going to mucopolysaccharidosis. So I have given you all the features here. You don't have to learn everything. You keep your notes with you. I'm going to show you the images. So with this, okay. So you have seen all the features I have given already in the notes. So you can see a child, a 6-year-old child, mentally retarded, and she has protuberant abdomen. And what you can see here is in the second picture, you can find a bulge. What is that called as? Tell me. Yes, that is umbilical hernia. Okay, correct. Then you can see Rayleigh body inclusions. Then hands, what is the feature that you can see in that hand? Yes, first hands. Polydactyly. Bullet okay, അത് നമുക്ക് പിന്നെ പഠിക്കാം. Wide epiphysis, okay, കുറച്ച് wide skeletal deformities are all there. Can I say it's clawing of hand? Classical clawing ഇല്ല അല്ലേ? Yeah, clawing of hand. Clawing of hand is another feature. And in the X-ray, what you can find is the second, you can see here, the middle phalanx is, the anterior aspect of the middle phalanx is degenerated. So if this is the middle phalanx, the anterior aspect is degenerated, and that is called as bullet-shaped middle phalanx. Now in the eyes, what you can find? Corneal opacity. Corneal opacity, because glycosaminoglycan is responsible for corneal transparency. So there is corneal opacity here. And this is the classical case of Hurler disease. Hurler disease. Now in the notes you can write what is the enzyme defect here. I'm going to write I alpha L iduronidase. This is the enzyme defect, okay? L iduronidase. Is it a direct message? I'm not. Okay, L-iduronidase is the enzyme defect here. Yes, beaking, correct. Beaking of vertebrae you can find. Pregrinus. Yes, beaking of vertebrae you can find in the case of mucopolysaccharidosis. Yes, L-iduronidase. L-iduronidase is the enzyme defect in mucopolysaccharidosis is called Hurler disease. Hurler disease, the mucopolysaccharidosis type 1, MPS type 1, okay? Type 1. Okay. Now I'm going to another case, this is a 16-year-old boy. He has no mental retardation. So the intelligence is normal. Okay. Then he has all the features of mucopolysaccharidosis, hepatosplenomegaly, umbilical hernia, cloying of hand, clouding of cornea, all these are there. But only difference here is the this is a child who is having normal intelligence. Then what is this? Just know the differentiating feature. That is She's disease. She's disease. I have given there She's disease. And what is the enzyme defect in She's disease? Same enzyme. So what is the same enzyme? L-iduronidase. But what is the difference? Can anybody type? What is the difference? I will tell you, you have to type partially defective or partially active. That is a better way to explain it. L-iduronidase is defective, but it is not completely defective. It is partially active. Can anybody type that? Partially active L-iduronidase. Yes, correct. Partially active L-iduronidase. This is what you can see in MPS 1 itself, but this MPS we call it as MPS 1S. Can anybody type that? This is MPS 1S. Just to know whether you understood or not. MPS 1S, correct. So that is She's disease. Rest everything is the same. Now I'm going to one more. I don't know. Okay. This is the third mucopolysaccharidosis you have to learn. So all the features of MPS are here. Like I have given a list of features, coarse facial features, all the features. Yeah, images are there. I've already sent you. Images I have sent to you in your group. Please see that. കിട്ടിയില്ലേ image? Ah, okay. Right. So all the features are there. All the features are there. Plus, what is the difference here is he is having normal vision and it is a he, not a she. So that is Hunter disease. Okay. Now, can anybody type what I'm saying? The enzyme defect is L-iduronate sulfatase. Correct. That is L-iduronate sulfatase is the enzyme defect. Correct. Very good. L-iduronate sulfatase. And remember, hunters are males and hunters should have a clear vision. Hunters are males, but always not. Hunters are males and they should have a clear vision. This is how you can remember MPS 2. What is enzyme defect? L-iduronate sulfatase. Hunter male clear vision. Correct. Okay. So these are the MPS you have. You don't have to learn everything. Now we are going to see some general features, only that you have to learn. And these general features have a name and that is called as something which starts with a G. Anybody knows that name? Mucopolysaccharidosis. Something which starts with a G. Gargolin, no, Prigrinus, you're right. Gargiolic facies, G-A-R-G. Can anybody type that? Gargiolic, G-A-R-G. Yes, correct. Gargiolic facies. Gargiolic facies is seen in our features. That peculiar facial features is called as gargiolic features. Right. So that is about mucopolysaccharidosis. So I have given you everything. What is dysostosis multiplex? Dysostosis multiplex means bone formation is defective. Okay, bone formation is defective. Rayleigh body inclusions is the inclusion body that you can see. Okay, the rest everything I have explained. Now coming to some general features. No mental retardation. No mental retardation. ഇതിനൊരു mnemonic കണ്ടുപിടിക്കാൻ തരുമായിരുന്ന വലിയ ഉപകാരമായിരുന്നു. Okay, so one we have already learned. She's disease. The second is Morotio Lamy disease. And the third one is more Q. She's Marutulami and more Q. No mental retardation. No need to learn every mucopolysaccharidosis. Learn this general features. No corneal clouding. Already we have learned one, that is Hunter plus Sanfilippo. No visceromegaly. More Q. More Q disease. Then no Rayleigh body inclusion. Again the same. More Q. More Q disease. No Rayleigh body inclusions. No more marriage, just sneham. Okay. No more, no mental retardation in she's. No more marriage, no mental retardation. M stands for Morkyo and Morotulami, and she's just Sneham. Okay. Just Sneham Matram. Correct. In real life also it is like that. Okay, fine. Okay. So that is MPS. So we have learned glycosaminoglycans. Just see what we have learned. Most important, you don't have to learn everything. Corneal transparency, charge selectiveness of glomerular basement membrane. Uh, okay. Then the MPS. Don't learn everything. Just learn hunter, hurler, she's. Then learn these general feature. That is enough. He's more quiet. Correct. More Q. Morotio Lamy. When she has wow. That's great. She's more quiet. Quiet you can write it as Quiet, right? Okay, okay. She Morchio mosquito. Morchio mosquito. Morotio monta. Let me take a pic, otherwise I'll forget. She has no mental return, so I took her to Morocco twice. Okay. She is wow, that's great. Morchio mosquito. Morotio manto. Manto. Oh, manto. Manto test you mean? Wow. She's more quiet and more tame when she has no touch. Great. Okay, this is great. Okay. So we have only one more topic, that is recombinant DNA technology. Then I will just show you all the images once more. Okay. So in the break time, in നമുക്ക് കുറച്ച് time കുറവായതുകൊണ്ട് I will just show you that images. So after that, we'll complete the recombinant DNA technology and I will finish. This is not an image, but very commonly asked, vitamin B1 deficiency, what are the features? So if you see all these corneal vascularization, magenta colored tongue, fissuring of lips and tongues, then B2. So what is this picture that you can see as flushing? Is it deficiency or toxicity? Niacin deficiency or toxicity? Yes, it is toxicity. So flushing is toxicity. So this is megaloblastic anemia. This we have seen today. Now what is this? Corneal lesion and ocular and cutaneous lesion. That is oculocutaneous tyrosinemia. This you all know, blackening of urine, then black pigmentation in the sclera and all, it is alkaptonuria. MSUD, this is the DNPH test. Then von Gehr's disease, they have a protuberant abdomen. Now this is a case of Pompey's disease. Similar case was asked, that is cardiomegaly and all. This is Pompey's disease. Galactosemia, he is using a glass because aphakia, because the lens is being pushed out. So lens removed. So he is wearing aphakic glass. So that is galactosemia. Hereditary fructose, it's not an image. Then this I've already explained, these two. So what is this? This is Crab's disease. So that what you're seeing, I know I'm not in a position to explain that. That is an inclusion body, I will just say. They are called as the globoid cell inclusion in Crab's disease. So please don't forget this. Without seeing this image, please don't go. Yesterday, the crab won't get fatty liver. Yes. Crab won't get fatty liver. Correct. I think we together can make an MCQ mnemonic bank. So what is this cross? What is this cross? Maltese cross. Okay. What is that? Calcification of adrenals. It is Waldmann's. This is the ackee fruit, okay? Ackee fruit. Hunter disease. Eyes, what you are seeing? Yes, lipemia retinalis, correct. And eruptive xanthoma and that white color, lactescent plasma also that is there. Disease of two. Two eyes, two tendon, Achilles tendon, that is type 2. Type 3 is tuberoeruptive xanthoma and the palms you can see, what is that? Palmar xanthoma, correct. This is not the classical picture, but still orange colored tonsils. That is Tangiers disease. This is HGPRTase defect. Then this is the classical picture of gout. That is, you can see tophi. You can see first metatarsophalangeal joints is classical of gout. This is vitamin D deficiency. Vitamin D deficiency, you can see bowing of legs, you can see the knee deformities, you can see. Then what is this deformity? That the second is a windswept deformity. Then the X-ray pictures, very, very important. Then vitamin A deficiency. And I have already also given the grade of xerophthalmia. Then in vitamin C deficiency, I think it is not here. Vitamin C deficiency, gum bleeding. What is the hemorrhage that you can see under the nail beds in the case of vitamin C deficiency? Vitamin C is not here. Hemorrhage that you can see under the nail bed. Yes, splinter hemorrhages. Splinter hemorrhages. Then hemarthrosis. All these features are there. Then, yeah, subungual, correct. So that is about the various images that I have shared to you. Now I'm going to the last topic, that is Recombinant DNA technology. We'll finish it very fast. Recombinant DNA technology, number one, what we have to learn is only two things we have to learn here. We have to learn about restriction enzyme and vectors here. Restriction enzyme and vectors. So first I will tell you about vectors. Number one is plasmid. What are plasmids? If this is a bacterial cell and if this is a bacterial chromosome, we can see some of the double strand circular DNA. You need not write it. I will send these notes to you, okay? So double-stranded circular DNA, which you can see extra chromosomal. They are called as plasmids. Now, we are not using, in the bacteria, what's the function of plasmid? That is also a question. That is to give or to provide antibiotic resistance. That is a function of plasmid. Okay. The insert. Next, what we have to learn is the DNA insert size, or how many amount of foreign DNA or a passenger DNA that you can incorporate into a plasmid. 0.1 to 10 kilo base pair, very less. 0.1 to 10 kilo base pair. Next is, I'm going to draw a diagram. You have to tell me what is this. This is infecting a bacteria. What is this? Phage, yes. So the second vector is phage. They are having a linear DNA and its insert sizes 10 to 20 kilo base pair. 10 to 20 kilo base pair. 10 to 20 kilo base pair. Yes. The third one is, again, it's actually a plasmid with the dash gene. So that gene I'm going to mark here. This gene is a cos gene. So it is actually a plasmid with the cos gene. Then we don't call it as plasmid. We call it as cosmid. We call it as cosmid. So that is cos gene. It is called cosmid. The DNA insert sizes is 30 to 50 kilo base pair. 30 to 50 kilo base pair. And the fourth one is artificial chromosomes. That means genetically engineered chromosome. Artificial chromosome. Example, these artificial chromosome we can create based on phage. Then we call it as PAC. So what is PAC? Can anybody tell me what is PAC? അയ്യോ ഉറങ്ങിപ്പോയോ എല്ലാരും? Phage artificial chromosome. Okay, one more I'll tell you. If we are creating it based on a bacterial chromosome, then we call it as BAC. Now, if we are making it based on a yeast chromosome, then it is called YAC. So, BAC, PAC, and YAC. These are the various artificial chromosomes. This BAC and PAC, the advantage is it has more insert size. It has around 300 to 500 kilo base pair. Yak is even more, 1000 to 3000 kilo base pairs we can carry inside a yak. So these are the various types of vectors. Correct. Phage artificial chromosome. Phage bacterial artificial chromosome and yak. Okay. So these are the various chromosome. I don't want to describe too much there. Next we are going. This is a very, very important topic. Restriction enzyme. This is the only thing that we have to learn. ഇതുകൂടെ കഴിഞ്ഞാൽ we are finished. Okay, so what are restriction enzyme? Restriction enzymes are enzymes which can restrict entry of phages in a bacteria. They are called as restriction enzyme because phages are always the enemies of bacteria. So they want to cut the phage. Phage അങ്ങോട്ട് കേറി കഴിഞ്ഞാൽ അവന് കഷണമാക്കും. Who? Restriction enzyme. So restriction enzyme is a bacterial defense mechanism. Bacterial defense mechanism. Okay. Now, this restriction enzymes is a type of hydrolase enzyme. Two types are there. Type 1, type 2. Two types, type 1, type 2. Okay. Type 1 cut at a random site. തോന്നുന്നിടത്ത് പോയി വെട്ടും. Wherever it is convenient, it will cut. But type 2 is not like that. Type 2 cut at specific palindromic site. Cut at specific palindromic site. So whenever we say restriction enzyme, that is type 2. These are the one which we are making as molecular scissors, not the type 1. So whenever we say restriction enzyme, is it type 1 or type 2? Please tell me, in the comment box, tell me, just to know whether, type 2. Yes, very good, type 2. Okay. Now, type 2 are molecular scissors. Now I'm going to show you what are the two types of actions of molecular scissors. So if we have a double-stranded DNA with AATT, TTAA, it's a palindrome. Likewise, AATT, TTAA. Two types of cutting can happen. Either the cut is like this, or the cut is like this. Now you have to tell me what will happen if the cut is like this and the other one. Just know the names, Karnam. Sometimes if a question is asked, blunt end and sticky end. Okay, so this is sticky. The other is blunt. Now here I'll tell you one more thing. Which is more useful? Is it sticky or blunt? Sticky is more useful. So can we convert blunt? This is BLUNT. Can we convert blunt to a sticky end? Yesterday ഞാൻ അജ്മലിന്റെ അടുത്തും കരുണിന്റെ അടുത്തും പിണങ്ങിയേ പറയണേ. Okay, so sticky end is more useful. Okay, so blunt end can be converted to sticky end by a process which is called as homopolymer tailing. Homopolymer tailing. Okay. So these are the actions of restriction enzyme. Now I'm going to give you some applied aspects of restriction enzymes. So if we have an individual 1 here and another individual 2 here, I'm taking one allele of allele എന്ന് പറഞ്ഞാൽ എന്താ? What is allele? നമുക്ക് രണ്ട് ജീൻ ഉണ്ട്. So അതിനകത്തെ ഒരു കോംപ്ലിമെന്റിന് പറയുന്നതാണ്. We have two genes because we are diploid organisms. So one, it is called as allele. So I'm taking the same allele of both the person. Same allele. So it is having 35 base pair. We are thinking that this allele is having 35 base pair. In the first person, there are there are two restriction sites, R1 and R2. In the second person, there is R1, R2, and R3. Three palindromic sites are there. Okay. So, in the first person, how many? So, if we do a DNA electrophoresis in the first and the second person, tell me how many bands we will get in first and second. In the first, how many bands will get? How many DNA fragments will get? 1, 2, 3. In the first, we should get 1, 2, 3. Right? Now, in the second, 1, 2, 3, 4. 1, 2, 3, 4. Right? So, we are getting 4 fragments. So, what is this called as? This is called as restriction map. So, what is restriction map? It is a unique band pattern for each individual when it is treated with same restriction enzyme. Which means if this allele is taken out and we are treating with one particular restriction enzyme, then we should always get 3 bands in individual 1 and 4 bands in individual 2. So that is called restriction map. Otherwise, this is the DNA fingerprint, or it is the DNA fingerprint. So after the Wayanad tragedy, what they have done is most of the bodies were unidentified. So what they have done is this fingerprint restriction mapping was done, and this restriction map was placed in each of this in all the person's coffin. In front of that, a QR code is there. So sometimes they are expecting that at one time, if one of the relatives come, they can scan the QR code and compare it with their DNA fingerprint. So if it is matching, it means that they are relatives. So I'm going to show you something like that. I will show you an image here. ഞാൻ അന്ന് കാണിച്ചിരുന്നു. Did I show this? So what is this technique called as? This is DNA finger printing. This is DNA fingerprinting. Yes, this is DNA fingerprinting. So you just see this. This is the DNA sample that we got from the crime scene. There are 3 suspects here. 1, 2, and 3. Can you see that? Now you see each one of this band. The first band you can see here. It is there in the crime from the DNA sample from the crime scene. It is there. It is not in the first and the third, but it is there in the second person, which means the suspect is 1, 2, or 3. The correct one is who is the real culprit is 1, 2, or 3. Suspect 1, 2, or 3. Okay. Suspect. Yes, right. So this is like we are matching the band pattern in various suspects with the band pattern that we obtained from the crime scene. Same thing we can do in disputed paternity. There is no dispute in maternity because we have to bear the child and we have to give birth to the child. Usually no dispute in maternity, but paternity is always a dispute. Okay, so in that case also, what we are doing is we are, if a child means Ada father, Ada mother, right? half is father, half is mother, which means the child should have the band pattern of father as well as the mother. So we are comparing the band pattern of the child. We have the band pattern of the mother, and we have the band pattern of the suspected fathers. So who is matching with this child will be the biological father of the child. So same thing. So that is DNA fingerprinting. Okay. So similarly, there is one more term that you should know. RFLP. What is RFLP? RFLP is restri restriction, fragment, length. Are you in the mess? Ab. Estilaano? Not polymerase. Polymerase. Polymorphism. Mute the mic. നിങ്ങൾ മെസ്സിൽ പോയി എന്ന് തോന്നുന്നു. കഴിക്കാൻ പോയതാ അല്ലേ? അമ്പടാ. ഓക്കെ. ഓക്കെ, ഇതും കൂടെ കഴിഞ്ഞ് തീർന്നു കേട്ടോ. മൈക്ക് ഓഫ് ആക്കടേ. റൈറ്റ്. ഓക്കെ, ഇതുകൂടെ കഴിഞ്ഞാൽ ഞാൻ തീർത്തു. Restriction fragment length polymorphism. എന്താണ് restriction fragment length polymorphism? So we are going to the here, okay? So we have seen two restriction map, right? So when we see these two, does it mean that individual 1 and 2 are abnormal ആണോ? Why I'm എനിക്കൊരു features ഉണ്ട് when another person is not having, it's not looking like me. So is it abnormal? അല്ല അല്ലേ? ഇപ്പോൾ ഫോർ എക്സാമ്പിൾ സ്വിംഗോമൈലിൻ ആൻഡ് ഐപാഡ് ഇസ് നോട്ട് ലുക്കിംഗ്, ഓർ സാംസങ് ആൻഡ് ഐപാഡ് ഇസ് നോട്ട് ലുക്കിംഗ് ദ സെയിം, റൈറ്റ്? So they are different. Why they are different? It is because, so that is what I'm going to say. Restriction fragment length polymorphism, or my question is why these band pattern are different? Or my question, another way the question is, ഒരു പേഴ്സണിൽ R1 and R2 ആണുള്ളത്, വേറൊരു പേഴ്സണിൽ at the same time it is having a DNA variation. Okay, so what is called as polymorphism? I'll just explain this. What is polymorphism? Polymorphism means they are normal genetic variation. This is not abnormal, which is present in more than 1% of population. For example, ഇതൊരു ഒരാളുടെ DNA, this is another person's DNA. DNA of number 1, DNA of number 2. So in one person, TA is present. In another person, at the same time, same location, in another person, you can find GC, which means here the variation is at, I'm not saying about the two strand, I'm just saying about one strand. So in one person it is G, in another person it is T. Is it abnormal? No. If it is present in more than 1% of population, it is a normal genetic variation. And this is called single nucleotide polymorphism. This is called single nucleotide polymorphism. This is the most common polymorphism. Okay, just to understand what is polymorphism. Can anybody tell me what is polymorphism now? I am not looking like a Chinese. കുറച്ച് ആൾക്കാർ പറയുന്നുണ്ട് എനിക്ക് കുറച്ച് Chinese faces ഉണ്ട് എന്ന്. I am not sure. I don't look like a Malayali. I look like a Chinese. Anyway, That's not the point here. Anyway, we are not looking like Americans. We are not looking like Japanese. We are not looking like Africans. Why? Is it because Africans are abnormal and we are normal? No. Everybody is normal. But they have different minor variations in the DNA sequence. Not minor. It is normal variation. That word minor should be cut. Normal variations in the DNA sequence is called as polymorphism. Okay. So because of this normal variation, ഒരിടത്ത് രണ്ട് വെട്ട് കിട്ടുമ്പോൾ വേറൊരു ഡി എൻ എയിൽ ദർ ഇസ് ഓൺലി 3 വെട്ടുള്ളപ്പം വേറൊരു സ്ഥലത്ത് ഒരു വെട്ട് രണ്ട് വെട്ടേ ഉള്ളൂ or something like that. So more than 1% of the population, normal genetic variations present more than 1% of the population is called as polymorphism. Okay. And in that, most common polymorphism is single nucleotide polymorphism. Okay. അപ്പോൾ ഞാനൊരു ക്വസ്റ്റ്യൻ ചോദിക്കട്ടെ. So, then what is mutation? So, restriction fragment length polymorphism means the length of fragments is varying. Because of what? Restriction. Enzyme is cutting the DNA at different positions so that the length of the fragments varies, and that is called restriction fragment. The fragments produced by restriction enzyme. What is varying? The length is varying. So restriction fragment length polymorphism. That is called RFLP. Okay. Now what is mutation? Yes, they are abnormal DNA variations in the sequence. Abnormal variations in the sequence which is present in less than 1% of population. That is called mutation. Okay. Now I hope you know about mutation. I'm not saying, just tell me what are the different types of mutation. What are the different types of mutation? വേഗം പറഞ്ഞു നമുക്ക് തീർക്കാം. Yes, frame shift എല്ലാവർക്കും വരുന്നുണ്ട്. Okay, so what we have to know is one is point mutation. That is mutation. This point mutation is equivalent to the single nucleotide polymorphism. But that is polymorphism, this is mutation. Point mutation, yes, point mutation. The most common point mutation is base substitution. Base substitution. I'm going to write 3 things here. Yes, nonsense, missense, and silent. So, UGC is changed to UGA. What is that mutation called as? Yes, point mutation, which is a nonsense mutation, because this is a stop codon. Okay. So sometimes if this mutation is like this, U is changed to UUC. What is this mutation called as? ഇത് പറയുന്ന ആൾക്ക് ഞാൻ GPay ചെയ്യുന്നതായിരിക്കും. മന്തി വാങ്ങിക്കാനുള്ള പൈസ. യെസ്, ആരാ പറഞ്ഞ? കറക്റ്റ് ആയിട്ട് പറഞ്ഞ ആദ്യം പറഞ്ഞത് ആരാ? സ്വാതി. ഓക്കെ, സ്വാതി എനിക്ക് നമ്പർ അയക്കാം കേട്ടോ. വാട്ട് യു പ്രിഫർ ഓൾസോ. ഓക്കെ, അതിനുള്ള GPay ഞാൻ ചെയ്യുന്നതായിരിക്കും. ഓക്കെ, റൈറ്റ്. Base substitution correct ആണ്, but what I want as the answer is silent mutation, because UUC is all coding for the same amino acid phenylalanine. So this is silent mutation. So if UUU is changed to GUU എന്തിനാന്നുള്ള എനിക്ക് അറിയില്ല കേട്ടോ, but still, what is that called as? What is that called as? Missense. Very good. Miss Ria. Right, right. ആ നമ്പർ അയച്ചു. ശ്രീഹരിയാണ് നമ്പർ അയച്ചത്. അയ്യടാ, ഒരു ആൻസർ പോലും പറയാൻ ശ്രീഹരിക്കാൻ അയച്ചു തരാം. സോ ദിസ് ഇസ് മിസ് സെൻസ്. Okay, so this is mutation. Now you say something about frame shift, അല്ലേ? What is frame shift? The cat eat rat. The കോഡൻസ് ആയിക്കോട്ടെ കേട്ടോ. The cat eat rat. Now in this, C is deleted, or in other words, one alphabet is added here, like for example D or something like that. So D added in between. Now what you can see, the cat eat rat. When C is deleted, what will happen? Genetic code always have a peculiarity. It is non-overlapping. That is, the 8, etra, like that it is written, right? So that is called frame shift. Yes, what you said is right, Aparna. Frame shift is deletion or insertion not in multiple of 3. എന്താണ് multiple of 3യുടെ പ്രത്യേകത? So that's what I'm going to write. The cat eat 10 rat. What happened here? A multiple of 3 is inserted. Then the will be there, cat will be there, eat will be there. Only thing is that you can find one extra amino acid in between. Then this is not frame shift. This is not frame shift. So deletion or addition not in multiple of 3 is not a frame shift mutation. Clear or not? So that is what I want. Right? Recombinant DNA technology I'm not explaining, but in this I will just share. I will share this note also. The last ionized, this was a question. What are the different enzymes used in recombinant DNA technology? അതാണ് ഞാൻ ഇവിടെ വെച്ചേക്കുന്നത് കേട്ടോ. So you can see it. എല്ലാം പഠിക്കാൻ difficult ആണ്, but still what I will say is you learn which of the following is not a enzyme used in DNA recombinant DNA technology. So these are the list. So in this, at least learn this left part, okay? This one. And this is the latest edition. CRISPR, that was there in the question. Okay, so this I will send to you. A reaction you need not learn. Primary use okay if you can, but learn the name of all these enzymes used in recombinant DNA technology. Okay, so that is about the recombinant DNA technology. Now finally I will just discuss scenarios നമ്മൾ ക്ലാസ്സിൽ എടുക്കാത്തത് മാത്രം. I will just run through that. Okay, now you see this. A 2-year-old boy presented with a decreased vision. He also has hypotonia, cherry red spot present, no visceromegaly. How will you clinically work up this case? So here, what is this disorder is what I want to ask you. Decreased vision, cherry red spot present. That itself tell you what is it? It's sphingolipidosis. Yes, sphingolipidosis. All these things I have explained. This also I have explained. In carbohydrates, I will just see. Okay. A 6-month-old infant, poor weight gain, feeding difficulty, admitted in a comatose state. He is icteric, hepatomegaly present, urine Benedict's test is positive, glucose oxidase test is negative, no cataract. What is this? Hereditary fructose intolerance, correct. A 2-year-old child with a short stature, difficulty in breathing due to large tongue, defective vision, recurrent upper respiratory tract infection, frontal bossing, depressed nasal bridge, corneal opacity, intellectual disability. What is that? Short stature, difficulty breathing, gargiolic facies is what you are seeing here. So this is a case of fructose intolerance. I do agree. Hurler. Most probably it is a case of Hurler. Okay, because intellectual disability is there, corneal opacity is there. Next, 10-year-old boy with normal intelligence presented with a defective vision, hepatomegaly plus coarse facial features present. Normal intelligence. Yes, she's correct. 6-month-old boy presented with gargiolic facies, visceromegaly. He has intellectual disability. Now, if I'm adding one more, that is no visual disturbances. Hunter, yes, correct. Now we'll go to amino acids, sorry, vitamins. A 2-year-old boy presented with a pedal edema, breathlessness, chest X-ray showed cardiomegaly. Investigation showed reduced erythrocyte transketolase activity. What is your diagnosis? Yes, thiamine. Manual laborer from a place where jowar is a staple diet, presented with erythematous rash around the neck. He also has complaints of loose stools. What is your diagnosis? Niacin, correct. 3-year-old girl presented with red colored tongue, rashes around the corners of the mouth, blood vessel creeps into the cornea. Enzyme activity which enzyme activity will you check? Let me see. Who will answer? B2 low, yes. Which enzyme activity? Glut Yes, glutathione reductase, okay? It is not peroxidase. Peroxidase, glutathione reductase. Glutathione reductase. Glutathione peroxidase contains selenocysteine. Glutathione reductase is the enzyme that you should check. IT professional frequently order food from online apps, rarely add any vegetables and fruits, presented with the tiredness, pallor present, peripheral smear showed macrocytes. What is the answer? Rarely add vegetables. That is the clue here. Yes, B9. Okay, so it is not B12. B12 also will have same feature, but here only like no vegetables. So B9. Physical trainer who owns a poultry farm used to consume lot of raw egg. Appo then what should come to your mind? Biotin. Okay, good. Partial gastrectomy developed anemia, tingling sensation. What is your diagnosis? B12. B12. Correct. So which is the biochemical marker in B12? Intrinsic factor low. Yes, correct. What is the biochemical marker here? Methyl malonic acid. Correct. Person complains of decreased vision in dark places like cinema theaters. Yes, MM-CoA. Correct. MM-CoA tanne aarse. A. Correct. Okay. Like this, D already I have given vitamin D deficiency. Then vitamin C deficiency is the one which I haven't given the picture. That can also be asked. Splinter, hemorrhage, gum. That you will definitely answer. Okay. So we have completed. Any doubt if you have, you can always free to ask me. You can ask me in Insta or Telegram or in a as WhatsApp. I have given my number to you. സോ താങ്ക് യു സോ മച്ച്. നമ്മുടെ ഇടയ്ക്ക് നമ്മൾ പറഞ്ഞ എനിക്ക് ഫോർ വെജിറ്റബിൾസ് ക്വസ്റ്റ്യൻ ഫോർ വെജിറ്റബിൾസ് ആർ ലെസ് യെസ് ഫോർ vegetables are less. Yes. ഇന്ന് ഞാൻ കുറച്ച് ലോങ് എടുത്തു. സോറി. Akhil Raj, yes. Okay, okay. Akhil Raj, yes. Please message me, okay? Akhil Raj, yes, എന്നെ ഒന്ന് മെസ്സേജ് ചെയ്യണേ. ക്രിസ്റ്റീന, പിന്നെ ഇന്ന് ഞാൻ കുറച്ച് സാധനം കണ്ടല്ലോ. നമുക്കൊരു നിമോണിക് ബാങ്ക് ഉണ്ടാക്കാം. നമുക്ക് ഒരുമിച്ച്. Akhil Raj, yes, and Christina. Correct, correct. Yes, yes. Zoom user ആരാണ്? Zoom user ടെക്നോപോവ ഒക്കെ ഒന്ന് റിവീൽ ചെയ്തിട്ട് എനിക്ക് മെസ്സേജ് ചെയ്യണം കേട്ടോ. പിന്നെ ഐപാഡ്. Yesterday, the crab won't get fatty liver. We are going to make a Insta post together. അമിനോ ആസിഡ് ക്വസ്റ്റ്യൻസ് നിങ്ങൾക്ക് എന്തെങ്കിലും ഡൗട്ട് ഉണ്ടെങ്കിൽ ചോദിക്കാൻ, ഞാൻ പറയാം. Niku thrive, failure to thrive, glutamine level, orotate level elevated, it is urea cycle disorder. Or agitated boy, pediatric OPD has peculiar smell of barns. Barns means mousy body odor, okay? Mousy body odor. ഇൻസ്റ്റ ഇല്ലേ, കുഴപ്പമില്ല, ടെലിഗ്രാമിൽ വന്നാലും മതി. Okay. A dhobi who took clothes from a hostel noticed washing clothes black color, alkaptonuria. Tall boy admitted with a sudden onset chest pain. Chest pain tall എന്ന് പറയുമ്പോൾ തന്നെ homocystinuria. Rashes around the neck. Her mother also complains bluish discoloration of diaper. That is Hartnupp's disease. Lethargy, failure to gain weight on admission. He develops seizures. Caramel odor. Caramel is maple syrup urine disease. So, bye-bye. See you all. You should all come to Calicut. And also one thing, yes, if you like, after the exams and all, if you feel that you find biochemistry interesting and all, you can just give a thank you message in my Insta also. I will post it in my story. Don't forget to tag me or collaborate with me. I am always with you. So exam ഒക്കെ കഴിഞ്ഞിട്ട് നിങ്ങൾ ഇൻസ്റ്റ ഒക്കെ യൂസ് ചെയ്യുക. അപ്പോൾ you can just make a post or a story and tag me. Bye bye. Love you so much. കാരണം bunch of students who just interacted with me like anything. So much. Love you. Bye bye. ഇത്ര ഒരു ഇൻട്രസ്റ്റിംഗ് ആയിട്ട് ഞാനൊരു ഓൺലൈൻ ക്ലാസ് എടുത്തിട്ടില്ല. Yes, bye bye. Bye തെരേസ. ചില ആളിലേക്ക് എനിക്ക് നല്ല ഓർമ്മയുണ്ട് മുഖമൊക്കെ. Barn smell is smell of mouse. Mouse is usually seen in barns, right? So mousy body odor is like a barny odor. അതാണ്. Barns means the place where cereals are placed in the sacks. So അവിടെ ആയിരിക്കും മൗസ് കൂടുതൽ കാണാം. So barny odor is mousy odor only. Mousy body odor. Bye. അന്നൊരു പേര് എനിക്ക് പഠിക്കാൻ പറ്റാതെ വന്നൊരു പേരുണ്ടായിരുന്നു. അവന്തികയോ, അൽക്കയല്ലായിരുന്നു ഒരാൾ, അൽക്ക, അനവദ്യ. കറക്റ്റ്, അനവദ്യ. യെസ്, അനവദ്യ. ശ്രീഹരി, നിനക്കിട്ട് ഞാൻ വെച്ചിട്ടുണ്ട്. എനിക്ക് ഒരൊറ്റ ആൻസർ പോലും ചെയ്തില്ല അവന്. ബൈ ബൈ. യെസ്, അൽക്ക, അൽക്ക. ഓക്കെ, അൽക്കയുടെ പേര് എനിക്ക് ഓർമ്മയുണ്ട്. പിന്നെ നമ്മുടെ അനന്തല്ലേ, അനന്തൻ കാല് വയ്യാതിരുന്ന ആളാരായിരുന്നു? ACL ഇഞ്ചറി ആരായിരുന്നു? അനന്തന് കാലിലൊരു വേറെ എന്തോ പ്രശ്നം ഉണ്ടായിരുന്നു. കാല് നീര് വെച്ചിരിക്കായിരുന്നു. ബട്ട് ACL ഇഞ്ചറി, ഹു വാസ് ദാറ്റ്? നവജീവൻ ബായ്. നവജീവന്റെ ഫ്രണ്ട് എന്തിയെ? വാട്ട്സ് ഹെർ നെയിം? ഐ ഡോണ്ട് നോ ഹെർ നെയിം. അക്ഷിത. ഓക്കെ ഓക്കെ ഓക്കെ. അക്ഷിത ബായ്. Sphingomyelin. Why you put the name as sphingomyelin? Because you love biochemistry so much. Oh, okay. Bye. 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 Sphingomyelin is required for the brain. Bye bye. Bye. See you all. എവിടെയെങ്കിലും വെച്ച് കാണുമ്പോ ഹായ് പറയാ. Come to Calicut. I am there. Bye. Mwah. Love you. വിടാൻ തോന്നുന്നില്ല. ലീവ് ചെയ്യാൻ തോന്നുന്നില്ല. നവജീവൻ ബൈ. സ്വാതി. സ്വാതി മന്തി വേണ്ടേ? ഈ സ്വാതിയാണോ മറ്റേ സ്വാതി? വേറെ രണ്ട് സ്വാതി ഉണ്ട്. ഗൂഗിൾ പേ ചെയ്തുതരാം കേട്ടോ. അജ്മൽ. നിന്നോട് ഞാൻ പിണങ്ങി. എന്റെ കരുണ എന്തിയേ? സ്വിംഗോമൈലിനോ? സ്വിംഗോമൈലിന് ഞാൻ എന്താ തരണ്ടേ? ഓക്കെ ഓക്കെ. സ്വിംഗോമൈലിന് എന്താ വേണ്ടേ പറഞ്ഞാൽ മതി, ഞാൻ തരാം കേട്ടോ. എന്തായാലും എന്നെ സ്നേഹിച്ച് സ്വിംഗോമൈലിന് പേരിട്ടതല്ലേ. സ്നേഹം മാത്രം മതി എനിക്കും. താങ്ക് യു സോ മച്ച്. ബൈ ബൈ. താങ്ക് യു. ഓക്കെ. ബൈ. മെസ്സേജ് ചെയ്യണേ.